Ready? Go.
Welcome back. Welcome back to the afternoon session of our conference.
Why can't we hear you?
Right? Are you okay? Good? Okay, all fine. Thank you very much. I now invite Mr. Amit Chandrafreya, consultant orthopedic surgeon, to introduce our next speaker, our Health Minister, Warren Gathing, MS, who will outline the health partnership between Wales and India. Mr. Chandrafreya.
Thanks very much, Murli. It's a great pleasure to introduce the first speaker for the afternoon session. And I'm grateful for all of you who have stayed through your lunch break to join this session. The next speaker is Warren Gathing, Health Minister of Wales. He was born in Zambia, but grew up in England and finished his studies in Wales. So he really has had a very diverse upbringing. And he has always been associated with Bapio and has always supported Bapio throughout Bapio Wales' tenure here in Wales. He's a British Labour and cooperative politician. He's a member of the Welsh government since 2011, and since 2016 has been the Cabinet Minister for Health and Social Services. For the past 12 months, he has been in the spotlight as the Health Minister, and he feels that the difficult decisions that he has had to take over these 12 months could be the difference between life and death. He's spent some time in India, and he's going to talk about the collaboration in health between Wales and India. Ladies and gentlemen, I present to you the Right Honourable Warren Gathing, Cabinet Minister. Thank you.
Just a second. No, there's no audio. Yeah.
Yeah, I think we are just having a problem. We'll be back in a second while we sort the IT issues. Well, this is the joys of virtual meetings, isn't it?
Thank you for inviting me to the conference. I'm sorry that I can't be with you in person today, even in a virtual capacity. I do hope I can see you all soon. The last 9 to 10 months have been the most difficult and testing time for our health and social care system, and for our staff who worked so hard in response to coronavirus. Our staff remain our most valuable asset. This has rightly been reinforced during these truly extraordinary times. We're all aware of how much and how big an important contribution, not to mention commitment, foreign-trained doctors and other healthcare workers make to our treasured NHS. Our most recent data of September 2018 highlights that foreign-trained doctors make up around 32% of our medical workforce, which almost half are from the Indian subcontinent. And the fact that the British Association of Physicians of Indian Origin in Wales should be very proud of those facts. In 2016, a recruitment initiative between Bapio and NHS Wales was launched to enable trainee doctors based in India to apply for a medical training initiative post within Welsh Health Board. As you all know, the MTI is a national scheme designed to allow doctors to enter the UK from overseas for a maximum of 24 months, so that they can benefit from training and development within our NHS before returning to their home country, a mutual benefit to both countries. I'd like to give thanks today to Bapio for establishing the relationships with medical institutions in New Delhi, Jaipur, and more recently in Chennai, and for supporting the NHS Wales workforce team in the recruitment processes within India, both of which are helping to make this campaign a success. In 2019, I had the pleasure of undertaking a ministerial visit to India. The purpose was to reinforce the MTI scheme operated by Bapio. The visit also provided me with an opportunity to cement and build international relationships, to see firsthand the recruitment processes in place, and to meet some of the candidates. Feedback following my visit showed the candidates were of a very high caliber. As we're all aware, the pandemic has been felt all over the world and has also had an impact on the flow of international staff. However, I am pleased to note that the total number of doctors recruited to our NHS between 2016 and 19 through the collaboration between Bapio and NHS Wales will be 110, a really important contribution to the medical workforce here in Wales. So I want to say once again how pleased I am to express my appreciation of the expertise and dedication for doctors from the Indian subcontinent, some of whom may be here today virtually at the conference. You provide not just vital clinical capability across our system to help keep our citizens healthy and impact positively also on the economic and social fabric of our country. Bapio's commitment to the ongoing campaign will ensure these doctors settle into their new roles and get the very best from the experience. I'm also pleased that the recruitment scheme is being expanded to include the nursing profession, and I look forward to hearing more as this expansion is developed further. Although I've focused on the recruitment element of Bapio's work, we must not forget the continuing commitment of the chair of Bapio Wales, Professor Keshav Singhal, in the development of the COVID-19 workforce risk assessment tool at the initial height of the pandemic in those early days in 2020. Professor Singhal has been instrumental as the chair of the risk assessment subgroup in the continuing drive to protect members of our health and social care workforce at greatest risk of harm if they contract COVID-19 and to identify ways to mitigate that risk. The subgroup comprises members from across our minority ethnic communities and leaders in their respective professional fields. It's continually reviewing emerging evidence, changes in government policy, and available data as it evolves to ensure the risk assessment tool is a live resource reflecting the most up-to-date position. The latest iteration was last month. As you have already heard today, that reflects the changes in advice for the clinically extremely vulnerable. But of course, our links with India are not limited to the contribution of medical staff. The economic relationship between Wales and India is going from strength to strength. Hardshell UK Limited established a surgical and respirator mask manufacturing facility in Cardiff in May 2020 as a direct response to global shortages of critical items of PPE. Led by the CEO, Mr. Anil Kant, the company has invested in excess of £1 million to create a new medical-grade facility capable of producing fully certified masks for frontline health and care workers. While the investment was assisted with funding from the Welsh Government, a crucial part of the project involved the sourcing of specialist technical raw materials from India. Excellent cooperation between the Welsh and UK governments and the Government of India facilitated this vital supply chain link during a time of significant global trade pressure. Hardshell is now part of an impressive list of firms who have responded positively to the First Minister's call for manufacturers to join their national effort to support health and care workers and to beat coronavirus. British technology and innovation is highly regarded and sought after in the Indian healthcare sector, with many UK businesses already enjoying visibility and success, from global pharmaceutical majors such as AstraZeneca and GSK to small and medium-sized enterprises and micro, small and medium businesses, including Micropore Technologies and Malvern Panalytics. The most significant partnership in recent times is the partnership between AstraZeneca, Oxford, and the Serum Institute of India to manufacture the COVID vaccine. The Serum Institute of India is now the world's largest vaccine manufacturer, with a number of doses produced and sold globally. Our thoughts, of course, are with all those affected by last week's fire at the Serum Institute in Pune. India's Wockhardt, the fourth largest generic drugs company in the UK, invested £17 million in 2018 in a new automated and state-of-the-art sterile manufacturing and testing facility to further enhance its existing manufacture capabilities in its UK base here in Wrexham. It is this plant that secured the UK contract to provide fill and finish production lines for AstraZeneca's COVID-19 vaccine for at least the next 18 months, and that project will create 40 new jobs. These are just a few of the examples of what can be achieved when two nations forge strong international links and work together. As an organisation, I encourage you to keep up all of your work, to continue to develop this important network, to share your expertise, and of course to learn from each other, to continue to provide informed, high-quality, patient-centred health services and resources for patients here in Wales. And in particular, I do look forward to better times where I can see you again in person to celebrate the special friendship that we have developed between Wales and India and all those friends I have made and the friends I have yet to make here within the Bapio community. With every best wish for conference today and the future ahead.
Thank you, Health Minister. Bapio is very grateful to you and the Welsh Government for supporting various collaborations with India. We will continue the theme between Wales and India with the next talk in our program. I will now invite Dr. Nidhika Berry, consultant microbiologist, to introduce our next speaker, Honorable Dr. Harshvardhan, the Union Health Minister of India, who will explain how India successfully managed the COVID pandemic.
Honorable Dr. Harshvardhan, Union Minister for Health and Family Welfare, Science and Technology and Earth Sciences. He's an ENT surgeon who branched out into public life in 1993. He is one of the prime architects of polio eradication in India, and in 1994, on the birthday of Mahatma Gandhi, he organized the mass immunization of 1.2 million children against polio in a single day. He pioneered the implementation of WHO's Essential Drug Program, revolutionizing governmental attitudes to public health care. As the Union Health Minister, his graded, preemptive, and proactive approach has enabled India to decelerate the pace of the COVID-19 crisis in India by strengthening the health infrastructure and building capacity in the fight against COVID-19. He is credited with evacuation of Indian nationals stranded overseas, massive community surveillance, and motivating scientists to come up with Indian-developed vaccines. Dr. Harshvardhan is known for his disarming simplicity in personal life and transparency at the workplace. He is the first Indian to have been nominated to the prestigious WHO body, the Strategic Advisory Group of Experts stage, and is currently the chair of the Executive Board of the World Health Organization. Thank you, sir, for being with us.
On करना है. Thank you, Dr. Nidhika. I fondly remember that a few years back, when I had visited Cardiff, I had the privilege and pleasure to address all my professional colleagues there in Cardiff and the adjoining areas in Wales. And I also remember Professor Keshav Singhal, who had organized that function along with you. And Just now, I am happy that I had the privilege to hear Dr. Vaughan Getting, your minister in Wales, and I can assure him that whatever he has talked about the relationship between India and Wales, more particularly on the health front, will make it stronger and will certainly adopt a more positive attitude towards this relationship. In fact, you have given me just 15 minutes to describe the success story of India, which is a very tall order. For me to do it in 15 minutes is a real Herculean task, as much a Herculean task as the fight against COVID was. But we feel proud in saying that under the leadership of our great visionary Prime Minister Narendra Modi ji, adopting a whole of government, whole of society approach, we could fight against COVID with absolute commitment, dedication, valor, and whatever you can say. It was a great fight, and at the end of 1 year, we feel quite satisfied about our success, which is definitely much better than most of the countries of the whole world. But we also feel sorry that in the fight we lost our people also. We lost many of our corona warriors, our medical professionals. But their sacrifices, I think they will go down in history of this fight against COVID. And I will start by paying my tributes to all of them. Just to be precise and to run through this story of 1 year in just 15 minutes, I have to tell you that India was the first country in the whole world to have responded within hours of the news that broke on 6th of January through WHO that a new coronavirus has been discovered in China. And within hours on 8th of January morning, we had called our meeting of experts. There we discussed this whole issue and started planning on the same day. And within the next week, on 17th of January, we had drafted detailed guidelines for the whole country. And they were issued to all the states in the country, to all the union territories. And on the same day, we had started a massive exercise of point of entry surveillance, which started with the airports. Then it also was done on at the seaports and at the land borders. And simultaneously, we started a huge exercise of community surveillance. Our first case in India was on 30th of January. A medical student who had come from Wuhan. And we started a contact tracing of the level which I can assure you that nobody in the world may have done that much of meticulous contact tracing, which we pursued and continued to do all through the year. In the first case itself, we had done a contact tracing of 162 contacts. And all this, whatever preparations we had to start, we had done much before. WHO had, in fact, called this as a pandemic of international concern or an emergency of international concern. We had a group of ministers formed very early in the fight in the first week of February itself, headed by the health minister. And this week itself, I had organized the 23rd meeting of this group. There were some 11 empowered groups of the top secretaries of all the related departments of the government. And there were regular meetings which were monitored by the Prime Minister, which were monitored by the Cabinet Secretary, which were monitored by the Health Minister. And if I have to count those meetings, I think their number will go into hundreds. We had a continuous interaction with all the health ministers, all the health officials of the country all through. And at any point of time, I would recall that there were a few lakh people who were under very close surveillance, meticulous surveillance, a surveillance which I think it's you have to actually see that, to feel that, and to imagine the level of surveillance that we had actually done. And this whole setup, when we had started, in fact, we had never thought that we are fighting a battle against a virus which is going to be so wild and which will spread so fast. So we started creating our facilities. You will be happy to know that India, when we started our fight in February, March, we had just one lab which could test the virus in this country. And today, when I am talking to you, we have already created 2,362 laboratory facilities where the virus is tested. We were amongst the first few countries in the whole world where we isolated the virus, and we started stepping up our health infrastructure in the country. And within few months, we in fact had developed over 15,000 dedicated health facilities for COVID, where there were more than 19 lakh beds. And on top of it, simultaneously, we created over 12,000 quarantine centers. When we initiated our campaign, we were short of PPE kits, we were short of N95 masks, we were short of ventilators, and but within no time, everybody rose to the occasion, and we converted that whole situation that into a blessing in disguise, difficulty into the challenge into an opportunity. And within no time, we came to a situation where we were producing 5 lakh PPE kits in the country every day. And during the course of the pandemic, we had sent over 400 lakh N95 masks and over 170 lakh PPE kits and over 36,000 ventilators, which we started manufacturing in the country itself. And during the early stages itself, where there was shortage of medicines all over the world, we were in fact exporting hydroxychloroquine to 150 countries all across the world. And then I would like to remind you that this pandemic was declared by WHO on 11th of March. And then we had that historic, most innovative Janta curfew in India on 22nd of March, where everybody, cutting across anything that you can imagine, whether it's a political party, whether it's any section of the society, whether it's a child or an old man, 100% people stood like a rock, and they were all supporting that Janta curfew. It was the most innovative thing that was done, and it came out successfully. And at 5 o'clock on 22nd March, everybody came out of his or her house, and they were lauding the role of the COVID warriors, the doctors. And then followed the lockdown, which was probably the biggest lockdown in the history of the country, and of course, maybe the world also. Total lockdown and then all those problems that we faced during the lockdown. And if I have to highlight one important thing, that was the issue of the migrant laborers, because they got stranded, they lost their jobs, and there was so much of difficulty. The government ensured that they managed to give food, money, and everything to more than 800 million migrant laborers for almost 6, 7, 8 months. And when there was a need, we in fact sent them to their native places through special trains. Almost 65 lakh of such migrant laborers. There came many situations and many problems like this. And the most important thing that we did was, in fact, we had to teach the society about the COVID appropriate behavior. So the Prime Minister must have addressed the nation, at least if I have to recall the last 1 year, must have addressed the nation at least 8-9 times, apart from organizing all these meetings. 117 crore people with mobile telephones. We could ensure that all through the 1 year, through a caller tune, they were given the right message through for the COVID appropriate behavior. We created the Arogya Setu app, which is probably the most, you can say, in terms of numbers, the most successful app in the whole world, where 16 crore, that means 160 million people, they downloaded the app, and it gave you a warning if somebody who is either positive or potentially positive comes near you. The Arogya Setu app in your phone will give you a warning, and so many other similar apps were actually created. And for doing all this exercise while we were fighting with COVID, with the strategy to actually test early, to track early, to treat early, and creating all these facilities in the hospitals, simultaneously, we ensured that at least, if I have to, in the initial few months itself, we must have trained during the course of that pandemic over 3 to 4 million workers, health workers, because COVID being a new disease, right up to the grassroots level in a country as vast as India, where there is a population of 1.37 billion people, we simultaneously trained people. How do you fight COVID? What are the norms of fighting COVID? How do you do the isolation? How do you quarantine? How do you maintain the physical distance? And this training program was continuously organized. And even today, after 1 year, the training program is being done for millions of workers who are involved in the vaccination process. Then I would just give you an idea that during the initial stages, I would say it's February, March, a lot of experts had come from various American universities and other places, and they gave huge, big interviews to the media here. And everybody said that India is going to be doomed. There is a country of 1.37 billion people. And how will you control it in the villages? How is it going to be controlled in the slums of India? And they had predicted over 300 million cases and 5 to 6 million deaths for India. And today, if I tell you that today I can very proudly say that we have the highest and the best recovery rate in the whole world, that's 97%. Our case fatality rate is just about 1.44%. And the total cases, against a prediction of over 300 million cases, 400 million cases, our total cases in India till now in the last 1 year is 10.7 million. And out of these 10.7 million, 10.4 million have recovered. They have gone back home fully healthy and having fought the disease successfully. And right now, today, I have just 0.17 million active cases in the country. I think this is something very unique. From a situation where I mentioned to you about these labs, simultaneously all our scientists, because I hold the charge of the science ministries also, all our scientists, they rose to the occasion. There was a battery of scientists working for vaccine development. There were people working for development of new ventilators, innovative ideas. There were people who ensured that new indigenous testing kits were developed in India. We validated almost 1,000 kits for testing. There were scientists who were working for repurposing of the drugs. And Then during the last 6 months, scientists had very actively worked for development of these vaccines. And you know that by now we have already given emergency approval to 2 vaccines, as has been mentioned by your minister also, that one of our vaccine manufacturer is supplying vaccine and making available vaccine for 60% of the, at least the developing world. And today also we are sending these COVID vaccines to at least a dozen countries. We have already started with that. We have got these 2 vaccines. Another 3-4 are in various stages of clinical trials. Maybe another 3-4 months we may have a few more vaccines in the country. From 16th of January, with the leadership of the Prime Minister, these vaccines, our health workers have started getting the vaccines. By first of day after tomorrow, our frontline workers will also start getting the vaccine. In the month of March, everybody in this country above the age of 50 will start getting the vaccine. On the first day itself, we vaccinated the maximum number of people vaccinated anywhere in the world. And today, when I talk to you, we have already vaccinated over 3.5 million health workers in almost 63,687 sessions. And whatever we are doing right now, apart from the things that we did throughout the year, the ensuring that the vaccines are given to the right people at the right time, and there is tracking and recording of everything in the best possible manner. We created a national expert group for vaccine administration in the month of August itself. For 4-5 months, there was continuous meticulous work, training of, again, millions of people at the grassroots who are going to give the vaccines, taking care of all possible precautions, adverse events following vaccination, and then ensuring that we have the most advanced, I say it is probably the most advanced platform in the whole world, which we call CoWIN. Earlier, for our routine immunization program, we used to have a EVIN platform that was a electronic vaccine intelligence network. Now we have, and that used to track the vaccine from one place to the other, along with the showing the temperature. Now this new platform that we have created, CoWIN, it also tracks the beneficiary, and the list of beneficiaries are uploaded, and there is a very meticulous automatic mechanism. People will get a text message about when do they get the vaccine, where do they get the vaccine, and when they get the vaccine there on the proposed day, everything is again recorded. It is again given back to them, and then for the second dose, they are given the reminder, and then they get an electronic certificate also. So a very, I would say, advanced platform, a CoWIN platform. And right now, we are, in fact, there's a lot of demand from other countries, especially the neighboring countries, that they want us to help them in various types of trainings for conducting the clinical trials, for developing platforms like this for the whole of their country. So I would say that the whole fight against COVID, it has been, in fact, you see, there are so many things that I can share. Wish you had given me an hour to talk about all this, but you told me that I have to finish everything in 15 minutes. I can tell you that the whole country, every social organization, NGO, scientists, professionals, doctors, nurses, everybody stood up behind the Prime Minister. And we all worked as a team, total whole of government approach. And we worked with a lot of patients. with commitment, dedication, and our doctors, in fact, simultaneously ensured that none of the non-COVID services were adversely affected. During the course of the last 1 year, we even developed telemedicine further as an institutional mechanism with development and notification of the guidelines, and almost people in the at the grassroots level getting consultations from the topmost in the medical colleges through the telemedicine. All these things were simultaneously developed, and with creation of these facilities, creation of the labs, and then simultaneously ensuring that the best possible research around this virus is also not compromised. We created biorepositories with over 50,000 virus samples there for the students, the university, the academia, and everyone to do the research about the virus. Even for this mutant strain which has come to the various parts of the, I think it's already entered 50 countries all across the world. Of course, it has come to India also. So something like 150, 160 cases are in India also. But we have adopted a very, very meticulous approach handling these. We were, in fact, doing the genome sequencing at least 6 months back. And we had already sequenced over 5,000 viruses in our laboratories. So even for the development of the vaccine, there's a fund of almost 1,000 crores which has been created. It's called the COVID Suraksha Kavach. You must have seen, if you have all seen the Republic Day parade this year, our biotechnology tableau, it has been awarded as the best tableau which has depicted the contribution of the biotechnology and the scientists and the development of the vaccine in the country. So I don't know if I can continue to talk because of the time constraints, but I would like to thank all of you. And I know that in England, the situation is probably a little more disturbed. This is what we hear from the news that appears on the internet and through other sources. But I can only wish you all good health. I know that, like doctors in India, you are also working under very difficult circumstances. But we feel proud that whether it is US, whether it is UK, or whether it is any other part of the whole world, wherever our Indian doctors are there, everybody gives us a feedback that our Indian doctors are working very selflessly with a lot of dedication and commitment. And that makes us feel proud about our professional colleagues, whether they are in API or in Bapio or in any other country. During the course of this pandemic, I also had the privilege to be nominated as the chairman of the executive board of WHO. Just last week, we finished our WHO executive board meeting, which ran for almost 8 days, 6 hours every day. And we discussed many of the issues related to health. So there's no time to discuss that. And even for the COVID also, we have been, every Thursday, we have been coordinating through the WHO with all the health ministers of the whole world, and sharing information and sharing platforms to ensure that we give the best to the people of this world. I have this strong feeling that though it may be called as a year of COVID, but it has been a year of science also. There's a huge contribution by the scientific community. What we are trying to impress upon people in India is, again and again, through all possible modes of communication, is to follow the COVID appropriate behavior. Until the time we did not have a regular vaccine, I had always propagated that the COVID appropriate behavior, that is the real social vaccine. And as long as you don't have the real vaccine, you never forget this COVID appropriate behavior. And the good thing is that this COVID appropriate behavior, which has been followed by people in India, at least it is our observation that a lot of other diseases, which are like airborne or they are transferred through droplets, etc. A lot of them have, their incidence has definitely gone down. So we are now entering into a new world with a new normal. And the greatest thing that has happened to the whole world is that health has come to the center stage of politics everywhere. In India also, there is a visionary plan to strengthen the health system, give more budget for health activities. There is no time to describe all that, but our Prime Minister had been otherwise also very passionate about health. We have already launched the National Digital Health Mission in a big way. Our Ayushman Bharat has already made very significant strides, and the Prime Minister has appealed to every Indian to contribute for an Atmanirbhar Bharat. And the results are showing in almost many fields. The economy is getting back to normal. And I can tell you on behalf of our government and what's happening here that very soon, when we get into the 75 years of independence, complete that next year in 2022, we would have certainly given India a new India, which will ensure that there is smile on everybody's face, there is adequate health, education, and nutritional facility for every child, and we can ensure safety of every woman. We can ensure self-respect for every elderly person, and only nationalism and humanism prevail in this country. That's the motto with which Prime Minister Narendra Modi ji is working. And this is his dream, this is our dream, and we are appealing to everyone in this country to also develop a dream on similar lines and blend his or her dream with the dream of the Prime Minister. And we also want all of you also to start dreaming around that and contribute for India's growth and welfare in the best possible manner through whatever modes you can. You have just now mentioned, your Honorable Minister has mentioned about the relationship in health between Wales and India. I look forward to many such strengthenings of relationship, and also your contribution in whatever form you deem fit for the welfare of our own Bharat Mata. With these few words, I would love to thank you once again, Dr. Nidhika and Dr. Keshav. I really have nostalgic memories of those few hours or a day or so spent with you in Cardiff. And I look forward to meeting all of you whenever you come to India, with my wishes for your good health and for your welfare, and also the wishes of the Prime Minister Narendra Modi, not only for the medical community, but also for all Indians who live in Britain. I close this talk. Thank you so much. Namaste. Jai Hind.
Namaste.
Thank you, Health Minister, for outlining India's impressive response to the COVID-19 pandemic. I agree, you definitely have to come back to Cardiff once we get through this COVID crisis, and talk and describe to us in detail about all the things that India has done. Thank you again for spending your valuable time with us. Thank you. We now move on to the next item. I now invite Mr. Ajay Sharma, Consultant Orthopedic Surgeon, to introduce our next speaker, Lieutenant General Dr. M.D. Venkatesh, who will be discussing medical education collaboration between India and the United Kingdom.
It gives me great pleasure in introducing Lieutenant General Dr. Venkatesh, Vice Chancellor of Manipal Academy of Higher Education. He graduated from Mysore Medical College in 1978 with an exceptional academic record and was commissioned to the Indian Armed Medical Corps, where he served for 38 years. He was the dean at the Armed Forces Medical College and instituted many cutting-edge technologies in education and medicine. He is credited with many achievements in cochlear implantation and neurology and has published his research extensively. He has displayed inspiring leadership in developing IT infrastructure, research, team building at Manipal University to take it to new heights. He is a member of the Medical Advisory Council of the National Medical Commission. He is member of the General Assembly of Indian Council for Cultural Relations. He is a recipient of numerous honors and awards, including the prestigious Vishisht Seva Medal by President of India. Welcome, Dr. Venkatesh. The stage is yours.
Thank you, Dr. Ajay Sharma. At the outset, I bring very warm greetings from Manipal Academy of Higher Education to all the members of Bapio, Wales. And as I look through the program, I see that I'm the only person perhaps who's speaking on something other than COVID. And I would keep it general in that sense, and also share a little information about Manipal Academy of Higher Education, and also a little about how the internationalization process in India with regard to higher education is progressing, and also the opportunities that the universities in UK and India have in collaborating and continuing our continued relationship. At the outset, I also thank Professor Keshav Singhal and Dr. Hasmukh Shah and all the members of Bapio Wales for inviting me to be part of this occasion. Just one sec. Yeah. Yeah. Sorry for that small little blip. Once again, bring warm greetings from Manipal Academy of Higher Education, Manipal. The Manipal is a suburb in the rocky hinterland in southern part Karnataka, about 8 kilometers from the Arabian Sea. The genesis of Manipal is an enthralling story of a genius of late Dr. T.M. Pai, who had the vision of getting society rid of three major ills: ill health, illiteracy, and impoverishment. He started the Syndicate Bank in 1925, Academy of General Education, to propagate general education in the erstwhile combined district of Dakshina Karnataka, Kannada, in 1942. And also, he was the pioneering person to start the first private medical college in India in 1953. 40 years later, Manipal became a university, and in the year 2021, Manipal Academy of Higher Education got the coveted recognition as an institution eminence from Government of India. MAHE, in its collective wisdom, have restructured the organization into three faculties: the Faculty of Health Sciences, Faculty of Technology and Management, Faculty of Humanities and Social Sciences. The Faculty of Health Sciences has about 12 institutes, and we also have two
Dr. Venkatesh, I think we're not seeing your PowerPoint. So I think your PowerPoint isn't moving. We are just seeing your title slide only.
Yeah, we'll just set it right, sir. One second.
If you wish, I think we have your presentation and we can play it from our end if that's easier.
I think so, sir. That will be better so that the glitch can be avoided.
Kiran, can we play Dr. Venkatesh's presentation? Yeah, what we'll do is we'll play the presentation. We will then transfer the Zoom control to you so that we okay. Next slide. Okay, if you just let us know next slide, we'll advance the slides, as you said.
We'll do that. Yes, yes.
Right, brilliant. I think the slides are coming up. Yep, here we have your first slide.
Yeah. So our Faculty of Health Sciences has 12 institutes. And can I have the next slide, please? Next slide. It's not moving there. Is the slide moving there, please?
Can you see our screen?
Yeah. We are seeing your screen. Yeah.
Oh, good. Yeah, we can see your screen perfectly.
Okay. Can we go back on one slide? Just go back on one slide. Yeah. The Faculty and Technology and Management has 7 institutes and 6 departments. And the Faculty of Humanities, next slide. Humanities had liberal arts, social sciences, and in one school and has 6 departments. And we have to move forward, sir. The slides have to move forward.
They are not happening. It's happening.
Is that the one you want?
Yeah. Can I have the control from there?
Yes, I think you can.
Just try to move the slide.
Right, we are just giving you the transfer control. If you'd accept,
Sorry for this.
advance the slides. Have you got the control now? Yeah.
Yeah. Okay. I don't think I'm able to move the slides.
Okay. I think we may have. Normally, you should be simply by either page up, page down, or the arrows. You should be able to move it up and down. If not, we can go back to next slide, I'm afraid.
Yeah, we will go on to the next slide. So just a brief this thing that Manipal Academy of Higher Education, as I mentioned in the previous slide, can you go back? The previous slide is one of the highest ranked private universities in the country, and also has a very decent international ranking. And we have a student strength of close to 30,000 students in our campuses, which is spread across 3 major campuses in India and 2 campuses abroad. Can we go to the next slide? Yeah. MAHE partnership with UK universities. MAHE world over has over 220 universities which are collaborating with us. And in the UK, we have more than 20 universities who are in collaboration with us in research, in education, in pathway programs. Collective priorities. Yes, please.
Please carry on.
Yeah. The collective priorities suggest that the common thread linking most of the universities is the demand for mutual recognition agreement, supporting student recruitment and institutional partnership. MAHE insists on greater research collaboration with all its university partners, as you can appreciate how MAHE and UK universities have benefited from collaborative research and joint publication. Just to drive home a point, MAHE, close to 30% of MAHE's publications has got international collaboration, and a significant number of them with the partnership with UK universities. Therefore, there's a great potential for us to take this collaboration forward. Can we have the next slide, please? We are looking at opportunities for collaboration in Wales. There are 8 universities in Wales, and I wish to place on records the intentions of MAHE to collaborate with each one of them. With all the 8 universities offering futuristic courses and promoting cutting-edge research, country has a long tradition of academic excellence, and MAHE would welcome collaboration with all the universities. We have a robust mechanism to foster international engagement for higher education, generating an effective and superior research collaboration, facilitating staff and student exchange, offering bespoke training, and establishing long-term sustained partnerships with universities of repute in Wales is ingrained in our mission statement. I am pleased to inform you that these are potential areas of research and collaboration at MAHE in the Faculty of Health Sciences in the field of emerging infectious diseases, cancer oncology, nanotechnology, drug delivery, geriatrics and gerontology, public health, lifestyle disorders, and drug discovery. We are exploring opportunities to expand our international network and would welcome expression of interest from universities in Wales to collaborate and cooperate with us in the entire range of internationalization, from student mobility right down to research, publication, and joint grant writing. Next slide, please. Yeah, on the silver jubilee of Bapio, MAHE extends its warm greetings. I congratulate the British Association of Physicians of Indian Origin, Bapio, on its silver jubilee anniversary. An organization that was established to support doctors arriving from India to work in the NHS has indeed grown in stature and influence. I congratulate the doctors, dentists, medical and dental students of Indian heritage, along with all others, for selflessly working around the clock for promoting professional excellence and leadership through Bapio's 4 channels: policy influence, education and training, advice to individuals, and global health and charity. I wish you all continued success in your efforts to promote access to better healthcare globally. Can we have the next slide? Bapio has rendered yeoman service in nurturing young doctors and aspiring healthcare workers from India by collaborating closely with the General Medical Council, Health Education England, and the Royal Colleges. An organization, no matter how well designed, is only as good as the people who live and work in it. The nation counts on you, sir. India looks forward to your continued action in India towards helping our graduates and other healthcare workers toward finding quality training and suitable employments in the United Kingdom. Next slide, please. During this pandemic, another very grave, important event happened in India. Despite the pandemic, in the month of July, the Government of India announced the new National Education Policy 2020, which perhaps is one of the most comprehensive education policies documents in the world. It covers the entire gamut from school education to higher education to professional education to technical education to adult education to vocational education. The entire gamut has been covered. It's a very, very comprehensive document with a very, very ambitious endpoint, which has been defined as taking India's GER, that is gross enrollment ratio in higher education, to close to 50 by 2035. Some of the important things, this particularly is about the objectives of internationalization to attain global quality standards, attract greater number of international students, opportunities to, some of the important opportunities that are there in the national education policies are to transfer credits to or carry out research at institutions abroad and vice versa, and counting for the award of degrees. And to offer courses like Indology, Indian languages, Ayush system of medicine, yoga, arts, music, history, culture, etc., to bring in a holistic element into the higher education. The purpose of internationalization is to collaboration with high quality foreign institutions to facilitate research and teaching and exchanges. And expansion plans which have been envisaged in the new national education policy is to permit high-performing Indian universities to be encouraged to set up campuses in other countries, and those from among the top 100 universities in the world will be facilitated to operate in India. Next slide, please. And some of the, the reforms and role for UK would be that if you look at the number of universities in India, it's close to 1,000 universities with close to 40,000 colleges, with almost 11,000 standalone institutions. Total enrollment is about 37.4 million. Currently, the gross enrollment ratio for females is about 26.4%, for males is about 26.3%. What is glaringly disproportionate is there is 80% admission to undergraduate programs, whereas in the postgraduate programs and the postdoctoral enrollment is only 11% to 5%. I think here is where there's a tremendous opportunity, especially in the field of health sciences, medicine, and other allied health and other things, that there could be a big role for us to play, and a big role for us to play between UK and India. And again, a disparity is seen amongst the inbound students and the outbound students. And the government of India wishes to bridge this disparity and get more and more inbound students to India going as we go forward. Next slide, please. Can we have the next slide? Hello? Yeah. India-UK Education Connection, the creation of India-UK Education Connection by British Council is a very, very welcome step. This bilateral 3-year program between 2019 and 22 is aimed at developing innovative education and English projects in India, building institutional capacity and contributing to systemic changes. Through this program, the British Council will create and co-fund projects and interventions with Indian central and state government, partners and universities, and involve engagement with UK organizations to bring in mutual benefits to both nations. Building mutually effective higher education collaborations between UK and India shall improve the skill base, investment, trade flows, and generate more jobs and prosperity in both countries, which is in alignment with our new national education policy. Next slide. The UKRE study in India. Education is an area where India and UK could pool some of the advantages for mutual benefit. The launch of UKRE study in India, which supports UK universities to collaborate with Indian partners to send UK students to India during their studies, is a fascinating initiative by the University of UK International and British Council. This program will be funded by UK and Indian governments as part of Phase 3 of UK-India Education Research Initiative and delivered by British Council, Universities UK International, and Educational Consultants India Limited. In fact, I'm happy to state that Manipal was successful with 6 UK student mobility grants in its maiden call, 2 with Portsmouth University, 1 each with University of Sheffield, Aberdeen, Edinburgh, Napier, and King's College London. This high percentage of success in a single call, besides supporting internationalization of Indian higher education through interinstitutional partnership, provides a big roadmap for future collaborations. And this mobility also promotes employability of UK graduates, and it produces globally competitive workforce. Next slide, please. In a study that was conducted, some of the benefits and barriers in Indo-UK ties were identified. There are complementaries between UK and India's education ambitions, but there are significant access barriers. Both the governments have to address it as a priority so that the opportunities can be realized. Research and knowledge enhancement are the most frequent benefits. Likewise, student recruitment from India can benefit UK universities by improving the diversity, culture, and student experience. There are a range of barriers that have limited UK-India higher education collaborations. The government policy needs to reform in the United Kingdom and in India, with immigration policies and, most importantly, mutual recognition of qualifications being the most common issues which have been identified. The reinstatement of a 2-year post-study work visa period, which the UK government has now committed, has come as a huge relief to many Indian students. Can we have the next slide, please?
I'm sorry, Dr. Venkatesh, we had a bit of a problem at our end, right? So just check and see which slide you need to be at.
Yeah,
we'll keep going until you tell us to stop.
Next. Here we go. Next. Yeah, here we were. Just listed out some of the benefits and barriers. The 4 verticals of Indo-UK Living Bridge is quality of teaching, quality of training, quality of research, capacity building and online learning platforms, digital literacy and physical access to internet ICTs, industry, university, academia partnership, upskilling, and lifelong learning. These are some of the 4 verticals in which the partnership can progress and reach the next level. Can we have the next slide, please? Next. One slide back. Yeah, the next slide. Yeah, Manipal Academy of Higher Education and British Council have signed an agreement to make International English Language Testing System, IELTS, available to students on campus in Manipal. This is something which is very, very unique. And I'm sure as we go forward, many other universities will develop such language testing facility, which will promote more students to and more professionals to get into UK and start working oblique training there. Can I go back to one more slide, if you don't mind? Yeah, this is the one. Yeah, next slide. Next slide, please. Sorry for this. No. Go forward, please. Forward. Yeah. Yeah, can we stop here? We have also signed an MOU with Health Education England. This is something which is already bearing a big fruit, emphasizing the need for high quality patient care. MAHE commissioned first Global Training and Education Center, GTEC, in collaboration with World Health Education England. With the inauguration of the Global Training and Education Center, MAHE has pledged to open up global medical programs for doctors, global learners program for nurses, global English school for healthcare, clinical communication wing, objective structure clinical examination training program for doctors and nurses, and general medical council remediation program for doctors. Bapio International Fellowship Program in collaboration with Royal College of Physicians, Edinburgh, and Health Education England is really exciting. And it is heartening to note that this training initiative is designed specially to help international doctors gain experience at the core and higher level in UK hospitals. I'm sure this model could be replicated across many other universities, and MAHE in its own is already promoting this to be implemented in one of its sister universities, that is Sikkim Manipal University, so that qualified health professionals can have an easy migration access to UK for training and for employment. Can we have the next slide, please? Next slide. I think I spoke about IELTS training. The United Kingdom Business Council Higher Education recommendations. Some things which is very, very critical as we go forward is mutual recognition agreements for foreign qualification. I think this is one of the biggest barriers, especially in health sciences, medicine, and other related specialties. Therefore, it's important that we need to look at having mutual recognition for qualifications in either countries to study, to undertake training, and also practice our professional wares in either of these countries. There's also a need to look beyond universities' overall ranking for international collaboration. This is something that is very critical for us to improve international collaborations in this entire range in terms of student mobility, faculty mobility, research collaborations, joint grant writing, joint publications. All these things can only happen when there is more and more widespread collaborations between universities in UK and in India. Often some of the universities would look at only collaborating with higher ranked universities. I think this needs to change a bit so that there is a more widespread and far-reaching collaborative arrangements so that the benefits could accrue to both the countries as we go forward. The other important thing that we need to look at is to promote education delivery adapting technology in online modes. This perhaps is very, very important, especially in health sciences, when you're looking at faculties who are unable to move across the countries, be available as adjunct faculty, as affiliate faculty, and be able to take the academic delivery through online mode. So this is something that we need to adapt. And I think COVID has taught all of us how to adapt to the the newer technologies and make it productive. As I foresee, I think going forward, the campus-based education program, though, will become the backbone of most of the education delivery. There would be a significant place for online education delivery and also a blended mode of educational delivery. And something which is equally important is support a university-to-university dialogue on university social responsibilities. So the government should also make employability skills for graduates a top priority and integrate vocational skills with mainstream education. The governments should also stimulate and support a university-to-university dialogue. And more and more emphasis should be paid towards university social responsibilities, towards helping the universities across the globe to collaborate more, to communicate more, and also to deliver more and improving the quality and productivity of each of these universities with the name of bringing health for all a reality as we go forward. Next slide, please. And as I see the future perspective, education will be vital if India is to reach its economic goals. And I would emphasize that India will need support from UK to educate its huge and growing student population. By 2030, India will have the largest number of people of college-going age, a staggering 140 million. And India has more doctors than it can offer postgraduate training. This is a very significant gap between doctors with undergraduate qualifications and doctors with postgraduate qualification and super specialty qualification. And we all know that UK has vacant training spaces. Both the countries can complement each other and learn a lot from each other. Being able to share students, staff, best practices, teaching and research material not only results in better education, but it will bring our societies closer, which has always been close, but it will bring them more closer, strengthening the living bridge that binds UK and India. These priorities align very well with Government of India's ambitions of India's higher education sector is set out in the new draft education policy. I'm sure there are plenty of opportunities with the new education policy liberalization as the governments are looking at, and more universities will collaborate, especially in the field of health sciences, in the field of medicine, towards having more and more mobility, more and more research collaborations, more and more joint grant writing, towards creating new knowledge and towards developing newer skills and enriching each other's healthcare to a greater extent. I thank once again Bapio Wales for giving me this opportunities, and I wish Bapio Wales all the success in all their endeavors in future. And I would assure from Mahe that we are always available. We are very, very open, and we are looking forward to internationalization in a very big way. And we would look forward to collaborating with universities from Wales in a very positive and promote this cultural and educational exchange to take it to the next level. Thank you very much, and Jai Hind.
Thank you, Lieutenant General Dr. Venkatesh. It was very interesting to see what the degree of collaboration in education between the two countries. I think there's clearly, as you say, there's scope for a lot more than what we currently have. Thank you again. I now invite Mr. Rahul Kotwal, Consultant Orthopedic Surgeon, to introduce our next speaker, Stephen Doty, MP, who will provide us with a global perspective on COVID-19. Rahul.
Good afternoon, everybody. I would like to invite our next speaker, Stephen Doty, Labour and Cooperative MP for Cardiff South and Penarth, and currently the Shadow Africa Minister and a member of the Home Affairs Committee. He was born in Cardiff, brought up in the Vale of Glamorgan, and has studied in Canada, Oxford, and the University of St. Andrews. As an MP, he has campaigned for justice for the poorest and the most vulnerable, and has worked on wide-ranging topics such as HIV, AIDS, climate change, mental health, and education. Ladies and gentlemen, please welcome Stephen Doty to give us a global perspective on COVID-19.
Well, thank you so much for the very kind introduction, and can I thank Bapio both locally and nationally for all the incredible work that you do, and it's great to see so many friends and constituents on the call as well, and particularly want to thank Keshav and Haz and all of the others who have developed the relationship over so many years, and I'm really proud to work with you and to know you, and I want to thank all of you on the call today because without all of you working in our NHS, not just in Wales, but across the UK, in our care, in our scientific sector, in clinical research, so many areas, we would be in an even worse situation than we are today. And so I want to thank you personally on behalf of my constituents in Cardiff South and Penarth, as well as on behalf of many of my fellow parliamentarians across the party lines. You know, what you do is absolutely incredible. And having spoken to many colleagues working in the NHS over the last few very difficult months, I've heard firsthand some of the incredibly difficult situations that you've had to deal with, and quite frankly the heroism and courage that so many of you as individual staff members and others have shown in your work in the NHS and more broadly. And obviously this week we've seen a very tragic milestone reached at a UK level, over 100,000 deaths, devastating impact in Wales as well, and in my own constituency. But of course we also see some of the signs of hope in declining cases, declining hospitalizations, and of course the vaccine delivery program. And you know, again, I want to pay tribute to all of those involved in that, locally, particularly the remarkable acceleration that we've seen and across the UK. And as we mentioned, I've had long-standing interests in international development and global health issues, as well as being a shadow minister covering those issues. I previously worked at the Department for International Development, and I also chair the all-party group on HIV and AIDS, and previously worked with Oxfam International on their global health programs with colleagues from around the world on global and public health issues. And I think you know, the comments from my constituency colleague and of course our health minister in Wales, Vaughan Gethin, and also you know, fantastic to hear from Dr. Vardan, Minister. They both have spoken incredibly powerfully about the need for international collaboration, not just on COVID-19 and the response, but on health and science more broadly. That absolutely must continue. And I think the incredibly vital partnership that exists between Wales and India, which has been so powerful for us and the world, whether that's in terms of people, expertise, science, manufacturing. Vaughan mentioned the role of the Bocart factory in North Wales, Serum Institute, so critical for the developing world and generic medicines and expertise, but also that cooperation through the WHO and other bodies. And I want to congratulate Dr. Vardan, the Minister, on his appointment as the chair of the committee. These partnerships are absolutely critical. And obviously we've seen some very positive developments globally in recent weeks, new vaccines showing promising results, collaboration between science and clinicians across the world. And of course, in the global political sense, the election of the new US President Joe Biden, returning the United States to the WHO is very welcome, reversing the very dangerous and ignorant agenda set by Donald Trump. But you'll have all heard what WHO Chief Dr. Tedros has said about vaccine nationalism, about the risks of a moral crisis, as well as you know, the huge health and economic impacts. And I know he's been speaking at the Davos Virtual Summit, explaining that, you know, vaccine nationalism and not cooperating will keep the pandemic burning, slow global economic recovery, but also it would be a catastrophic moral failure. And you know, we've seen unfortunately some elements of that overnight, a very regrettable situation developing yesterday evening with the European Commission, which thankfully that they have stepped back from. And I think we need to take great care and think of the greater global health, economic and political good when we're considering some of these very difficult issues. But beyond the issue of vaccines, obviously the pandemic has been devastating globally, 100 million cases, 2.2 million deaths, and that's before we even look at the impacts of long COVID and otherwise. And I've been speaking with many clinicians, development specialists, scientists, and political figures across the world over the last few months, particularly in recent weeks with the head of the African Union Centre for Disease Control, Dr. Nkengasong and his team, as well as some of the other leading virologists, health workers and others. And I've also been speaking to people on the front lines in health services around the world, from Sierra Leone to India, who've been giving me the very reality of what is happening and some of the challenges that they are dealing with, but also some of the incredible innovations and developments that they have undertaken to deal with the pandemic in their own countries. I just wanted to touch on 2 or 3 key issues and some key challenges going forward globally. I think firstly, in terms of the challenges, we obviously have the direct impacts of COVID, and there are many competing trends going on here. Obviously very devastating impacts in some locations, but in others we have seen perhaps not as big an impact as we would have perhaps expected. So when we look at, for example, the sort of the paradox really of some of, for example, of the countries across the Central African and East African belt, perhaps far lower levels of hospitalizations and deaths than we would have expected. And there's a very interesting article from Dr. Nkengasong and Dr. Maeda, his colleague from the AU CDC, that I'd recommend to you on this. And there are many different hypotheses which they're currently testing. It could be to do with the population demographics and youthful populations. It could be to do with acquired immunity from exposure to other disease, parasites and others, and a whole series of other factors. And it's very important that we understand those. But there are countervailing examples. I spoke this week with the health minister for Malawi, a country again which has close associations with the UK, with Wales and with Scotland in particular, and heard a pretty devastating story there of how in this second wave they're seeing a much greater rate of infection, hospitalizations, huge pressures on hospitals, inability to access piped oxygen, for example, to respond immediately. And also we need to understand what has really happened with the virus. There's been studies, there's a study by Yoga, which I'd recommend, where they've undertaken serology studies in Kenya, for example, that estimate that the levels of infection are actually much higher than are apparent by the testing rates. So, for example, their evidence from serology studies suggests that in fact, there have been 2.2 million possible infections by COVID-19 in Kenya, and that's compared with the officially reported rate, which I think is around 80,000. So we need to understand fully what is happening. Second issue really is the secondary impacts on health systems and care. I've been struck by the examples that I've been given both by global bodies, but also by individual country representatives and health workers, that some of the things that we've seen happen in other disease outbreaks, for example, the Ebola outbreak recently, which led to actually in some areas increased deaths from other diseases, whether measles, HIV, TB, increased rates of maternal mortality, that we are seeing, of course, again in this scenario. And I work specifically on HIV, and I think it's worth reflecting that even in 2019, with the treatments that are available, with the testing, with the knowledge that we have, we still saw 1.7 million new global infections for HIV in 2019 and 700,000 AIDS-related deaths. And UNAIDS and bodies like the UN Global Fund that I work very closely with have estimated that we could see 500,000 excess AIDS-related deaths in sub-Saharan Africa alone as a result of the additional pressures on health systems, the diversion of resources, inability of people to access antiretroviral treatments, testing, therapeutics and others. And of course, the lockdowns in many countries have impacted on people's ability to access other parts of health services. We've seen that, of course, impact in our own country, but of course, we're seeing this hugely globally, similar impacts with TB and otherwise. Thirdly, the tertiary impacts on economies, on conflict, on already fragile societies. We see some governments using COVID as a cover to abuse human rights of particularly marginalised groups and to deny access to healthcare for certain groups, or in worst case scenarios, extremist groups, whether it's ISIS, Al-Shabaab, others, some very, very worrying evidence that they're using the fragility and chaos caused by COVID to pursue incredibly deadly agendas. And of course, the devastating impacts on already fragile economies could last for many years. There will be huge economic, social and political consequences with that. And of course, that is very varied depending on the approach that individual countries have taken. Taking Africa, for example, the AUCDC has done remarkable work, I think, in increasing capacity. There's been huge collaboration between a number of countries and really incredibly positive work, much that we can learn from as well. But in some countries, I give Tanzania as an example, very limited non-pharmaceutical interventions, a lot of COVID denialism, and yet the virus undoubtedly spreading through populations. So some really serious challenges. Going forward, some key things. I think firstly, all of this, and this has been reflected in some of the other presentations, reflects why we need to invest sustainably in global public health capacity and all that goes around it, and not just in individual products such as vaccines, but in every aspect of our health systems globally. We need to invest in things like surveillance, in diagnostics, in domestic production capacity in many locations. What one of the leading virologists said to me, you know, some of this is traditionally been seen as the not sexy stuff, but we've got to do it. Zoonotic research as well, understanding those links between human to animal transmission and vice versa. You know, getting the basics of being able to have enough reagent supply in a country to be able to undertake research and testing. And of course, we see these threats from new variants. You know, surveillance will be absolutely critical, that genomic sequencing capability and otherwise. And there's some really important work that the UK is doing globally in Africa and elsewhere, and working with those to share some of our expertise, which I think is hugely welcome. And in Wales, we have some particular excellent expertise on this, and I hope new partnerships and collaborations will happen. And of course, we have to see the training and resourcing of public health systems in countries worldwide. You can have vaccine, you can have therapeutic treatments, but of course, if you do not have nurses, doctors, facilities, coordination, cold chain capacity, then you are obviously not going to be able to have the impact that you need to have. And there is a huge amount that we can do working together globally on all of those things. These are arguments I've been making for many, many years, and I hope that we will see global sustained investment in public health systems. Three challenges to finish with for the UK specifically. Firstly, whilst we've seen some really brilliant support globally, the UK has decided to cut its aid budget. It's decided to abolish the Department for International Development. I think that's a huge mistake in the middle of such a global pandemic, and from an agency which has played such a key role on global health. Health, the UK government say, is still a key priority, which is welcome, but we need to see that turn into actual action. You know, are we going to maintain our commitments to the WHO, the UN Global Fund, fantastic programs like IAVI, CEPI, and others? It is absolutely critical that we do that. Secondly, we need to invest in that scientific, technological, and political collaboration. Thirdly, we must not lose the focus on those other diseases and health challenges, because otherwise we will see an additional hidden toll in the millions on top of the direct deaths from COVID. And lastly, I think, and we all have a challenge on this, and this has been very clear in many of the conversations I've had globally, is misinformation and fake news about vaccines, about health, about any disease. And we saw this tragically in the HIV epidemic. We see it for many other diseases, and we are tragically seeing it over COVID. And this is a global challenge for tech companies, for media, and for political leaders. And what they say and what they do matters. And we've seen brilliant examples of leadership globally on that. And we've also seen some very poor examples of leadership on it globally. And the cost of that is in human lives. I know that all of you on this conference today recognise these global challenges. You've shown that by your lived example and the work that so many of you do. And I hope that we will continue to see this as a global challenge, a global fight for humanity, and that beyond COVID, we will see global cooperation on health, science and technology going forward.
Thank you. Thank you, Mr. Doty. That was brilliant. I think you've given us a much, to look at the bigger picture. That the impact of COVID-19 is not just the medical impact. There are a lot of other impacts that that will be the effect of the COVID pandemic even after it's over. We move on now to our two panel sessions. The first one, exploring what could be done better with the COVID-19 pandemic, will be chaired by Professor Parag Singhal. Professor Parag Singhal is a consultant endocrinologist. His widely quoted research on hepatic glucose production paved the way for newer treatments in diabetes. He is the executive director and CEO of BTA and the national secretary of Bapio. He is also a specialist advisor at the Care Quality Commission. Both within the UK and in India, he is actively involved in projects focused on cost-effective utilization of limited resources in healthcare. Today, he will use these skills to lead the panel discussion. Over to you, Professor Singhal.
Thank you, Dr. Raj. Myself, so later. Yeah, okay, thank you. So it's a great pleasure to welcome you all to this such an important panel discussion of reflecting on hindsight, which is obviously wonderful. Could we have done anything different? So to introduce the panel, first of all, we have got Professor Andrew Goddard, CBE, President of Royal College of Physicians. A very warm welcome, Bod. We have got Judge Ray Singh, who is also Chair of Race Council of Wales. We have got Dr. Hasmukh Shah, Secretary of Bapio, Wales, and a very well-known GP in Wales. And we have got Dr. Bailey, who is Chair of BMA Wales. Welcome you all. UK has sadly witnessed more than 100,000 deaths, what we call within 28 days of diagnosis of COVID, and confirmed 45,000 deaths, or more than 45,000 deaths, where COVID was attributed as one of the causes. And these are grim figures, and these are lives lost. And it is rightly that questions are being asked whether we could have done anything differently. Yes, hindsight is wonderful, but clearly to take this discussion further and our expert panel members to comment what is exactly we could have done different is today's topic. Even Honorable Prime Minister has conceded, yes, some things could have been done differently. What I suggest is, given the time constraints, that we have got few questions, and rather than every panel member responding to every question, we put a specific question to every panel member and then respond. So basically, it will be an attempt to cover as many areas as possible. So if I may start with you, Professor Goddard. When the pandemic started, do you think there was something specific which we could have done differently, of course, with the hindsight of 12 months experience?
I think the big thing is that we started from a very, very bad position. We had exercise sickness back in 2016, which showed that we had some major things to do and some reorganisation and leadership that was needed. We'd not invested in Public Health England, and yet were expecting Public Health England to suddenly be able to upscale and deliver things at pace, and they weren't ready for that. And plus, we've been underinvesting in the health and social care workforce for decades and decades. And so both systems were not really ready for it. I think then, when it started to happen, with the retrospectoscope, you say, well, if we'd have stopped everybody disappearing on their holidays in February half term, we would have made a massive difference. Because what would that meant? What we ended up with was multiple ports of entry from that half term. We know that many of the cases that arrived in wave one were from Spain or from Italy, and probably due to travel in that half term. And I think if we'd have known that, perhaps we would have stopped flights as we have done now back then. I think that would have really given us a head start. But because we weren't prepared and we didn't have an effective test and trace system, we hadn't got a pandemic plan that ensured that we had analyzers, all the reagents that we were short of, the PPE supply, it meant that we were from a really, really difficult starting point. And not only were we probably not in the right stadium for the race, we were probably wearing concrete boots. So it was going to be really, really hard to perform well in that race.
Yeah, no, thank you. But what do you think the lack of response, or you using the hindsight, was because we did not have enough information about the virus? It was a new virus, or was it we didn't take the thing seriously despite knowing the seriousness of the virus?
I think we all watched it from afar, and we made the mistake early on that we made two mistakes. One was thinking this was like SARS, the original SARS, which it wasn't, because SARS was easy to identify because people were only ever symptomatic with it. There were not asymptomatic cases. And when people were unwell, they were very unwell. And the other mistake we made was trying to compare it to influenza. And it's a very different virus from influenza in the way it behaves. All the modelling that we had, and you remember, and it remains that the modelers have taken front stage. If you look at those models, they were so variable between each other. And I can remember long heated discussions with graphs going up and down about should we close schools, should we not close schools? And the bottom line is we just didn't know, because we didn't know how this virus was going to behave in a UK population. And because we didn't have the contact tracing systems that were set up on the other side of the globe, or we had the public health measures that were available to China. So if you look what China did, they effectively put everybody on house arrest, allowed one person out every 3 days, and if you went out and you weren't allowed, you were arrested. And just you wouldn't get away with that in the UK. So I think we have to be careful that we don't try and over compare. But I think you were right, Parag. We didn't really understand this virus well enough back then. And if we had, we're all sitting here now, and if we knew what we know now, we would have all quite willingly said, okay, let's everybody just stay in the houses. Let's not go anywhere. Let's not fly anywhere. But we didn't know that, and so we didn't.
Thank you. Thank you. Can I now come to Judge Singh? So being a layperson, during the second lockdown, when it all started, what exactly happened was the schools continued to be open and we closed the economy. So actually, we didn't even manage our figures or NHS pressures well, and we also destroyed the economy. So do you have any take on whether at that time the schools should have been closed? Of course, notwithstanding the fact that, education is important.
It's very difficult to answer that because lack of knowledge, lack of understanding of the virus was the main, I think, one of the main causes of not taking immediate steps. And somehow the information which was coming through that children of that age may not contract this virus. So that led to leaders saying, we'll keep the schools open because it is vital to keep the children in education. But I think the variant, which then created whoever is coming into contact with, could be innocent carriers of the virus, and the teachers who were overlooked, I think, in many ways, that they could be coming in with virus in the schools, and they could be passing on to the children who could be taking it back out into their homes innocently. And I think on reflection, on hindsight, of course, we should have closed everything down, as Professor Goddard said. If we had that knowledge, we couldn't obviously do what China did, but we could have persuaded people, as the government has persuaded. And First Minister was very clear yesterday that although the R rate is coming down in Wales, we are still not ready to open up to the whole community. So, and I think hindsight is well and good, but we are where we are now.
That is very true. But just leading on to that, during the month of February, March, April, May, it was becoming very obvious the seriousness of the disease. And do you think, as a layperson, that public could have discharged their responsibility a bit better, and what they started doing in June and July and rushing off to holidays and everywhere, they could have been a little bit more cautious and helped the government and helped the NHS?
I think they fell in the same category as the leaders fell early in this episode. They did not realize the seriousness of it. I think lots of people thought, if I went away on holidays in sun, I'll be fine. And the seriousness didn't come. And it really, that awful figure, which we have just seen of 100,000 people, somebody's family, somebody's loved ones. And I think it is now has filtered into the community that, yes, it could be us next. It could be my father next, my grandfather. So I think there's more of a caution now than it was in February.
Thank you. And my colleagues within the audience, I think the moderators are monitoring the chat box. So we will be looking at the chat box for questions for the panel. But can I now come to Dr. Bailey? Dr. Bailey, one of the sad realities of this pandemic has been loss of lives of health workers.
Absolutely.
And majority of them sadly have been from ethnic origin. And linked to that, I mean, what do you think went wrong and what do you think could have been done differently as far as the death of health workers is concerned?
Well, clearly one of the first things that could have been done was getting up to speed quicker on the PPE issue. We've had a lot of stories early on in the pandemic where managers were bullying people to go into COVID positive areas with less than adequate PPE. That's largely been solved since then. I think we didn't know at the very start about the issues that some ethnic minorities were more susceptible to the virus than others. That's become tragically obvious since then. And I think it's fair to say that the risk assessment tool that Kesh Singhal actually developed has put Wales ahead of the rest of the country in that it is the only, to my knowledge, risk assessment tool that's used universally across an entire country. So I think that was a very important thing for us. There have been other ones developed, but none that have got sort of universal coverage across the country. Now that we've got reasonable degrees of PPE, we're in the situation where we now have the new Kent variant, which is both more lethal and significantly more transmissible. A lot of our colleagues, of course, 93% in the last survey that we did of our members, have had their first vaccine. So the death rate amongst our colleagues hopefully will significantly decrease over the next few weeks as that immunity comes in. The other issue that comes on there, though, is transmissibility. And we don't know exactly how that's going to work. We don't know how much protection from onward transmission you get both to families and patients after the first vaccine. And I think we do have to be very clear that we need to be doubly careful with our PPE in hospitals. We need to continue to do all of the things that we've been doing with social distancing. I think we need to very seriously consider the use of FFP2 masks throughout the health community for all doctors, nurses, and other healthcare workers, to try and make sure that whilst we've got the start of some protection, we're making sure that our patients and indeed our families continue to be protected until we've all had our second doses, because I think it's very important that we don't lose sight of the issues now, that the other protections that we can do still will prevent some transmission. So I think we need to be doubly careful on PPE. We need to look carefully about whether we need to upgrade that because of the Kent variant, and hopefully we'll get through the next few weeks by making sure that we don't take our eye off the ball now.
And one of the things, Dr. Bailey, what Dr. Mehta in his address was highlighting, that more and more ethnic minority frontline workers were being put at frontline.
Yes.
Do you think that contributed to the death of predominant ethnic minority workers?
I genuinely do. We know now that the risks for most ethnic minorities go from 2 to 4 times that of the general population, allowing for sort of sex, gender, and age. And it's quite clear that it is not just about PPE. Some of it was about a degree of bullying that went on. Some of it was about less ability to speak up for themselves. And I think that, yes, it's quite clear that some of our ethnic minority colleagues were put at higher risk because of those issues. It's not just about protection. It's also about trying to make sure that we can stand up for our colleagues. And there was definitely some bullying going on early on in the pandemic. I think we've probably got past most of that now, but that's something that's endemic and has been in the health service for years. And I think we've still got a fair way to actually improve that ongoing. The BMA's got now a BAME special group to try and speak up for these particular issues. And I think that we've still got a way to go before all of our colleagues, all doctors, are being treated in exactly the same way. So yeah, I think there's still some way to go there.
Linked with that, coming to Dr. Shah, the two groups which were predominantly affected due to virus were ethnic minority, not only health workers, but others also, and elderly care group. And now I will come to my favorite question or favorite topic, and board will like it, is vitamin D. So do you think, although looking at the evidence and not a lack of evidence, do you think it has any role to play? Dr. Shah, being a very experienced GP, what is your take on that?
Thank you. I strongly believe that vitamin D has real role. Now, there is no proper randomized trial, but there is observation data said that those people who has got adequate vitamin D and they got COVID infection, they were not having severe complication. Also, the BME group, people who has got a dark skin, they don't, because of melanin, they don't absorb the vitamin D. So they are more at risk. Also, what confuses us, like in a lockdown, the poor country gave a different message for the lockdown. And that means people were confused, population were confused. Same thing on vitamin D dosage. Poor country told differently. The Public Health England said 400 units. Our Wales said 1,000 to 2,000 units. So the different message came from the vitamin D, from public health, from 4 countries, like lockdown. Second thing, it is known that when there is a proper dose of vitamin D, the severe viral infection are protected. So this is a virus. The COVID virus is a different type of virus. Second thing, during the lockdown, people were at home. So I thought like nursing home people, the people who are in prison and people who are locked down, they should have been given vitamin D. And finally, vitamin D, when a patient is admitted with the COVID, they should be measured vitamin D. And if it is lower, they should have been given the high dose to start because there is nothing to lose, but we would have prevented the death. We would have, I'm not sure, but we would have not gone to the 100,000.
Yeah, thank you, Dr. Shah. And I think it is right because as an endocrinologist, we deal with vitamin D deficiency all the time. And 400 units is perfectly reasonable for bone health. But when it comes to endocrine system, which is very hungry, and immunity, actually it needs a lot more. And I think I will just talk about this data, which I've got only just now. And this is comparing deaths per million in Andalusia, which is region of Spain and UK. So the deaths in November, when we were all talking about the lockdown, in Andalusia region, there were 179 deaths per million. In Spain, there were 156, or rest of the Spain. And in UK, the deaths were 169. What Andalusian government did, they started giving active metabolite of vitamin D, which is fast-acting, calcifediol. And that brings your vitamin D level within 5 hours to normal level. And what they did was they rolled a program out in Andalusia to give this calcifediol to all care home residents, every care home residents. And in month of December, after rolling out this program, the deaths in Andalusia fell from 179 to 88, only 88. In Spain, they continued same rate. In UK, the deaths rose from 169 to 247 in December. Look at the January data. Andalusian deaths remain constant at around 88, 90. The rest of the deaths since rest of the Spain are still the same, higher than Andalusia. And UK deaths in January are 396. This is the data till 27th of January. Now that is food for thought that makes us think, is this something we are missing? And Andrew, while I fully understand, because Royal College has to look at the evidence, and quite rightly, I mean, we have had conversation around vitamin D, and I fully appreciated the position college took. But do you think college could have gone further to say, let us at least check vitamin D levels of high-risk population so that we get a better idea of how we are dealing?
You know, to me, there is a plausible argument that vitamin D will have a benefit in this setting, and that we know that because vitamin D deficiency is commoner in many ethnic groups, that is relevant, as well as societal groups and different ages. So particularly within care homes, for example, vitamin D deficiency, as you know, is very common. The data which we published in our own journal that suggests actually the 400 dose is probably too low for the UK population, and we should be aiming, particularly at this time of year, for a high dose. I'm fully on board with, and that's why I've tried to support that. I think that the problem is we still don't really have a convincing and I found it very frustrating. We've had it's a really easy thing to do, a big randomized control data. There is a multi-center study in Spain, of which Andalusia is part of, which we're eagerly awaiting. I think the Spanish data is fascinating. And there is no doubt that Andalusia has a lower rate than other parts, but it's not dissimilar to other parts where they haven't done it. And also over the past few weeks, Andalusia has seen a massive increase in cases despite the VIT-D supplementation, such that they've now contemplated lockdown. So it is a complex thing. My strong word to anybody watching this is there is no reason not to have vitamin D supplements. I know that many people do take it. I don't, but I think if you feel at risk, then I have absolutely no problem with you taking 1,000 units.
Yeah, I mean, you're right. And I think that's a very, very pragmatic approach. My vitamin D, when I did it in March, when the pandemic started, was only in 11 nanomoles. And since then, I've been taking doses to correct my vitamin D deficiency. And the point I was making was, at least measurement of vitamin D would have given us some more information, and we could have corrected the doses or corrected the levels adequately using nice guidelines or whatever. So only time will tell you, right? It's a complex situation, and only time can tell what it pans out. My final or important question, and starting with Bod, and maybe this is something all panel members would like to comment on. The government and the NHS England did fantastically well, or rather all the governments did fantastically well in creating Nightingale hospitals in such a short time. But do you have a sense that they were utilized optimally, and or something could have been done, or they could have been designed better or flexibly to allow or to ease the pressure on the NHS?
Parag, to me, it comes back to what I said at the beginning, is that the infrastructure was there, nice buildings, lots of lovely beds, lots of equipment, no staff. And it was very clear we did not have enough staff. We had barely enough staff to keep the hospitals going, let alone the new Nightingale hospitals. And until we address the staffing issues that we've got within health and social care, we'll run up to this problem time and time again.
Yeah, if I could come on and absolutely agree with Andrew. It's been quite clear. We've built these centres all the way around the country. Hardly any of them are being used. Certainly none of them are being used in the way it was originally trumpeted in March and April. People put incredible amounts of effort into doing it. But the bottom line is that unless you've got experienced staff who can look after really sick patients, it was never going to work that we were going to use them there. The efforts we made into getting more ventilators, that was great because they all went into hospitals. They were parked almost anywhere they could be fitted in. The Nightingale centres may well have a role, although it's probably going to diminish now in terms of convalescence, but they were the answer to the wrong question. The right question was invest more in the health service so we had staff that could actually cope, that we had enough beds in our main hospitals that could cope. And that's where we've gone wrong. And that wasn't going wrong last March. That's been going wrong over the last decade.
Thank you, David. Judge Singh, do you want to comment on that?
I agree that I think there's something wrong with my screen now, but I hope you can hear me.
Yeah.
We already knew there was shortage of staff, experienced staff, and that wasn't foreseen, and instead and planned to replace those. Instead, they were built expensive Nightingale hospitals, and as one of the speakers have said, Professor Goddard, I think, that we just unnecessarily built those without, instead that money could have been expended in addressing number of other issues.
Yeah, that's great. And Dr. Shah, just a question that when they were building Nightingale hospitals, and Bod is so right, surely they would have known that there's not enough staff to look after this extra infrastructure. So what was going wrong?
I think all the 7 LHB, their idea was correct, but they planned differently. They thought that they advertised, they did not get the proper staff. They did not realize that if this is empty, what they're going to do it. At the time was changing, the number was coming down, our number was going up. Every field hospital was working differently in Wales. So all planning was not uniform, and then the beds remain empty, and then people left because the people who had a particular contract, they stayed, and some people left. They employed some locum people and that sort of thing. So
And-
they did not utilize.
Yeah, and a specific question to you, Hasmukh Bhai,
Yeah.
because you have been a GP for so many years, you would have known the old days of community hospital or step-down beds, which were cared by GPs. Do you think the Nightingale hospitals could have been used as community hospitals by carers and monitored by GP? Do you think that could have been one of the answers?
I think the similar thing what happened. We were saying that, for example, that when you want to do Oxford vaccine, you should make sure you utilize the primary care because we are used to that. And the government, Wales government said initially, David will agree with me, Wales government were not agreeing with us. Ultimately, they realized that primary care is the correct people to do. Same thing in this one, because we have look after the community hospital, we used to admit the patient, so we know the setup. And I think if we would have discussed with the BMA, Bapio, and the primary care group, because our GPC Wales, I think we would have done better job.
Thank you. I think our time is up and we have had a wonderful discussion. I would like to take this opportunity to thank all the panel members, about Judge Singh, Hasmukh Bhai, David. It has been an excellent discussion and some thought-provoking discussion. So thank you on behalf of Bapio Wales. Thank you very much. And yeah, great.
Thank you for sharing.
Thank you, Parag. Thank you very much. That was brilliant. We will now move on to our second panel. This panel will consider whether there is a silver lining behind this pandemic. This discussion will be moderated by Professor J.S. Bamra, CBE. I invite Mr. Rahul Kotwal, Consultant Orthopedic Surgeon, to introduce Professor Bamra.
Thank you, Murali. It is my pleasure to introduce Professor J.S. Bamra, CBE. Professor Bamra is the National Chairman of Bapio and also a Senior Consultant Psychiatrist and Honorary Reader at Manchester. He has published extensively in peer-reviewed medical journals and has received numerous awards, including a CBE. Please welcome Professor Bamra to moderate a session on Is there a silver lining behind the pandemic?
Thank you very much. Thank you. Well, folks, this is where it gets a little bit more positive. I just want to take one message from Parag's session, which is really important, something that Professor Goddard said, which is the NHS should stop investing in mortar and bricks, and it should invest in the staff. I think that was a really important message. Now, so I think that we have a session when we're going to talk about a silver lining. Now, it might be difficult for you folks to appreciate. I hope everybody can hear me. Ramesh, can you hear me? Yeah.
Yes, we can.
So it might be difficult for you to contemplate that there's been any silver lining behind the pandemic. I can hear an echo from myself, but it's not coming from my side. But look, this is what we're going to do. The organizers want us to be something positive. And actually, I did a session with a spiritualist Indian guru called Sadhguru, and he said the pandemic was going to happen. It was going to happen because these pandemics are designed, these disasters are designed for us to stop and contemplate about life. Now, so this is about silver lining. The difference between an optimist and pessimist is that a pessimist believes that every silver lining has a cloud, whereas every optimist believes that every cloud has a silver lining. So ladies and gentlemen, my work is cut out because we have 4 great panelists. I hope they're all here. So I'm going to introduce them very quickly. I'm going to brief in my intros because they are very well-known people, and also time is short. We have 20 minutes to do this. So Dr. Martin Marshall is a practicing GP and chair of Royal College of GPs. Dr. Phil White is the chair of GPs, GPC BMA Wales, and the CEO of North Wales LMC, and a practicing GP for nearly 40 years. And we have Dr. K. Jagadesan, who is the president of the Indian Medical Sciences Academy, with us as well. And finally, we have Dr. CDV Jones, CBE, who's the chair of HEIW. And I'm hoping that you will all join me in this wonderful, positive presentation. So where should we start off? I'm hoping that Martin is here. Can the organizers tell me if Martin is here? I didn't see his name in the, anyway, look, let's start. I'm going to go in the running order that I have here. So then I'm going to ask Dr. Chris Jones, please. So our task is just say something positive that you've taken out of the pandemic. So Chris, over to you, sir.
Well, for a start, silver linings means hope. And I think the start of the hope, I felt, was the announcement of the great success of our scientists across the world and the development of the vaccine. that flagged for me there was hope. But I really thought about this question, and I think there is a lot of potential hope because we've been pulled up by our bootstrings. What's happened is we've gone from a world that's been pretty predictable into unpredictability. And of course, we love evidence bases. So what happens if you haven't got the evidence base? Well, I'll tell you what happens. You get clinical leadership. So for me, one of the great hopeful things of this is the rising of the sap of medical leadership. The second thing is, for a long, long time, we in Wales have spoken about health and social care. And if ever there was a message that it's looking after people that matters, both their clinical needs and their social needs. And we've learned very hard lessons about inequalities. And actually, in learning it, we owe something to actually do something about it. And we've heard today what we've done during the pandemic, but that is not going to stop. So I am hopeful that all of us have learned a very bitter lesson, that you ignore those who are lesser or well off, those who have got inequalities built in either through their ethnicity or through money or whatever. But we do need to be hopeful for our children. And that's where I think the big challenge is. We've spoken an awful lot today about treating people fairly. I think we have to look forward, and in Wales we've got a Future Generations Act, and that always makes me hopeful. So one of the things I think we need to do is learn the lessons from this and make a solemn promise that instead of just parking it in some kind of report or retrospective, that actually we keep going with the skill sets, that we maintain the energy for innovation that we've developed. And the thing that's really warmed my heart and given me more hope than anything is the loveliness of human relationships. And when you see the acts of kindness, the acts of commitment, the acts of bravery, the acts of foolishness, the standing on the doorsteps and rattling your saucepans, what we heard from India about everybody putting their shoulder to the wheel, that's a wonderful thing. And if we can encapsulate that energy, that spirit, I think 100,000 deaths is an awful lot of cloud. However, all of those people need to be celebrated, and celebrated by making things better. And I think we are in a better place now to pick up the cudgel and make things better.
Thank you very much indeed, Chris. That is lovely. Okay, so without further ado, move on to Phil. Phil White, what's your silver lining, sir?
Well, the fact that this conference today has managed to reach out across the world live. You've seen the effective sort of video presentations, pardon me. And of course, pre-COVID, we'd seen the likes of Babylon in England setting up remote consultation, because we've got a younger generation that seems to prefer to do things along computer links rather than face-to-face. And the convenience of it had them signing up in droves. Now, of course, this has been accelerated into general practice across the board. We've had to do it to keep ourselves safe, to keep our patients safe, and video conferencing and teleconferencing and assessment like that has become the norm. And I see that as a great step forward. I think it was on the way anyway, but it's been accelerated by this pandemic. And now I think it's here to stay. Doesn't mean we're not going to have face-to-face consultations. There are people that will always need it. It's just we're elected now, and we will be perhaps dictating the terms. There has been the time when people were just phoning up the surgery and making an appointment, quite often for something that wasn't yet alone relevant. So at least now we're in a position we're controlling appointments far more effectively, seeing the patients that need seeing, and I think providing a better service already. And hopefully after the pandemic, when everybody is vaccinated, a lot of this practice will carry on, because I think it is best practice.
Thank you very much, Bill. That is terrific. Dr. Jagadesan, positivity, both from an Indian perspective in India and what you might think. I'm sure you know UK very well. What are your key messages, please?
Is there a silver lining under this all what we have gone through, the pandemic? Nearly 2.21 million valuable lives we have lost, and many have recovered. All this, of course, we have to find a solution for this one, both preventive as well as curative. This preventive aspect, what we were working for the past 1 year, we've made use of the science, nanoscience, that is the zeta potential we are making use of, and the virus has got a negative zeta potential when compared to our body's zeta potential. This zeta potential, when the virus invades your system, our zeta potential drops to nearly 5 +5 or in the negative range. So this gives a clue to the diagnosis. Those we have tried out 183, another 300 is on, and there it gave a good ray of hope with around 98.4% accuracy. It is giving the zeta potential that is measured when you place your hand on the replica, as shown here, this model, where there are infrared sensors fixed and at the fingertips, and these will measure the following data: 1, the zeta potential; 2, the blood counts, that is RBC, WBC, platelet, and the differential count, the oxygen saturation, and also the oxygen saturation, the smell and taste. All these parameters are recorded in, say, 10 seconds. Within 10 seconds, a gloved hand is put on the replica which I showed, and it will read out all these things within a few seconds, and it is recorded. Then it is compared with the actuals. We found such a very good sort of comparison, and it is worthwhile putting into operation. Very cost effective, and it prevents cross infection, and especially the frontline workers. They come into contact with these cases. They can take abundant precaution, and those who are going to office or factories where people assemble, this will be a screening device at the entry point. So this sort of advantages are there, and no swab for culture, or swab for RT-PCR and blood tests. None of those things required. Everything from the skin, we can measure these things, and it is giving a comparatively good result, encouraging. So we are pursuing with this one further. Of course, we got this clue from our onco tracker, that is for breast CA. We worked some 12 years back, and also the nanoparticle which we use for prosthetic valve to prevent clotting, blood clotting, bacterial colonization, and fungal colonization. All these have turned into, at this time of pandemic, we try to develop this new technique, and it is encouraging. Similarly, applying the same zeta potential, your antiviral RNA antiviral agent has got a zeta potential of around 25. So if whatever agent you are choosing, the higher the zeta potential, definitely it will knock out the virus. Some of the nanoparticles we have found out, and still work is on, and some of the other materials where high levels of which are in use, we can try out these things. Our partners, MOU partners, we are collaborating with, and they are helping us in sorting out this therapeutic aspect of this one. So there is a silver lining. Hopefully, in the very near future, we will have a complete answer. Thank you for the opportunity.
Thank you very much, Jagadesh. So that is what in India, it's hard to translate it, but there's a word called jugaad. Jugaad is like an invention, but what you've done is amazing. So thank you very much, folks. Actually, I think that Dr. Marshall can't join us, unfortunately. So we've got a few more minutes on this. So I want to capture what you said, folks, because there have been really positive comments of what you've said. Chris, particularly what you said seemed to hit the chord in a number of places. And of course, the way that I look at it, just taking on board what you folks have said. So digitally, we've been catapulted at a faster pace than we might have done otherwise with the pandemic. Medicines, we've seen 18 months to produce so many vaccinations. Well, that could never have happened in my lifetime before, and I've done a lot of random controlled trials. So when science puts its back up to it, it can certainly come up with the goods. So vaccines have been great as well, and there'll be other medicines that have come, dexamethasone and that sort of thing, to treat the virus. Social strategies, which obviously social distancing, although I would say social distancing does not mean psychological distancing, please. That's one thing that we've suffered with, which is psychological distancing. Face masks and all that sort of thing, sanitizers, and innovations, which we've just heard from Dr. Jagadesh. So let me give my panel, esteemed panel, just a minute again to wrap up their message, if I may. I'm sorry, time is of the essence, but you're doing very well. You've put a lot of positivity in it. Chris, may I go that way? Go same order?
Okay. Many people in this conference aren't just clinicians, they're teachers and trainers. And I would like to say that all the efforts you have made, all the time you have spent supporting those in training during this pandemic will reap wonderful rewards going forward. And what we are hearing from students is, yes, it's been tough. Yes, it's been challenging, but massive amounts of very positive feedback about the time people have spent, the dedication that clinicians have given to making sure that the training and the learning continues. And what's more, we've learned to learn quicker and in different ways, and we spread learning much quicker. So as a chair of a health education improvement organization, I have to say, that's a real crock of gold.
Phil, may I come to you, sir?
Yeah, I think I agree with Chris there. I think we have integrated our teams far more. From a general practice perspective, we've really worked very, very hard. All our staff, from the receptionist through to the senior partners, worked extremely hard. And we're doing it again now with the COVID vaccination. We're getting on with it now that we've had the Oxford, which is much easier to handle in practice. It's noticeable that in Wales, we've gone to top of the pile for vaccination rates now, the minute the general practice were involved. We are the people who can vaccinate. We do vaccinate year on year. We've given almost 1 million flu vaccines towards the end of last season, and now we're going to start again, and we will rapidly get this country back to normal.
Wonderful. Thank you very much. Dr. Jagadesh.
Yes, this is only the preventive aspect. what I mentioned, I think the therapeutic aspect, as other speakers mentioned, I think we have to go ahead aggressively with the vaccination program, and other modalities of therapy will take us a long way and get rid of this dreaded evil, from saving the humanity for the future. Thank you, sir.
Thank you very much. Thank you very much. That's the ultimate message, saving humanity from the future, because there will be other pandemics. This is the mother of all pandemics, but there'll be a grandmother of all pandemics. I should say grandparent of all pandemics. So we will be better prepared. And lots of good messages about all three of you. Thank you ever so much. You've really helped us to be a little bit more positive about the future. And of course, from Bapio's perspective, that is a real silver lining, which is BINA, British Indian Nurses Association, which I stand between BINA being launched and prolonging this session to make you more positive, but that might become a negative. So I'm going to hand over now back to the organizers for the launch of BINA Wales. Thank you very much, folks. And thank you, Chris, Phil, and Dr. Jagadesh. Thank you very much.
I now invite Dr. Hasmukh Shah to introduce another new initiative by Bapio. First of all, you have stolen my thunder. Okay, I seem to have lost what happened. I lost my connection altogether. Okay, anyway.
Dealing with the COVID-19 pandemic has been challenging for the doctors. However, the effect of COVID-19 has been even greater on the nurses who are in the front line providing the most personal care to the patients. Bapio Wales is proud to launch the British Indian Nurses Association Wales. Now I invite our chair, Professor Keshav Singhal, to introduce this new association.
Thank you, Hasmukh. I'm not really going to introduce the association. We've got the British Indian Nursing Association in Wales being launched today. And I think it gives me great pleasure in announcing that this Welsh division will be launched today, because the association between doctors and nurses is an inseparable one. It is an absolutely essential and vital relationship, and it's but natural and but just that the role played by the nurses of Indian origin in keeping our population safe be formally recognized through this launch. For this, can I invite Dr. Ramesh Mehta, the president of Bapio, to come on the stage. Would also then like to invite Professor Jean White. Professor White, CBE, is the Chief Nursing Officer of Wales. She trained as a general nurse in Swansea and practiced as a theatre nurse in Wales and in London, and has held senior positions in nurse education at the Welsh National Board, at Health Professions Wales, and in the Welsh Government. She was appointed as the Chief Nursing Officer of Wales in 2010. Jean holds a number of visiting professorships and academic fellowships, and is the fellow of Queen's Nursing Institute. She was made a Commander of the Most Excellent Order of British Empire in 2017, Queen's Birthday Honours List, and became a member of the Order of St. John's in 2018. Welcome, Jean. Next, I would like to hand over to Kumar, who is the chair of British Indian Nursing Association UK, who would take this initiative forward and introduce you to his fellow officials and the Welsh division. Kumar, over to you.
Thank you, Keshav. Thank you. Can you hear me? Yeah, thank you. Good afternoon. Right. First, I'm thanking my organization for this privilege to lead the British Indian Association. I would like to express my sincere thanks to Bapio, especially Dr. Mehta, Dr. Domra, and Dr. Singhal for their support. First, I would like to share a short story about our journey so far. Dr. Mehta and I discussed about the idea of a nursing association about 3 years ago. We had a vision about how we as Indian healthcare professionals could unite and influence our healthcare system for the benefit of our patients and staff. During the time of COVID and Black Lives Matter, I got similar conversations with some of my peers like Suresh, and we had a strong conviction that we needed to provide a supportive platform for our nursing community. We have been guided by that conviction, and BINA started in August. We had a grand inauguration in November, and today we are here, still guided by that conviction. We are here to launch BINA in Wales. Today is an historic day for nursing in Wales, Great Britain, and in India. Indian nurses are the second largest group among non-European Economic Area nursing group in UK. There is an increasing dependency on international recruitment. More Indian nurses are expected to be recruited. BINA will play a pivotal role with all the key stakeholders to ensure quality pastoral support for international nurses. Furthermore, BINA will work with the Wales healthcare system to ensure all our nurses are supported to thrive in the UK healthcare system. As a chairman of BINA, I am blessed and privileged as this is a historic moment for Wales nursing and the Indian nursing diaspora. I thank all my executive committee members for their hard work, cooperation, and their dedication to this noble cause. They are a great team. I would like to extend my warm welcome to Professor Jean White, Chief Nursing Officer of Wales, and my Bapio and BINA members for joining us and making this occasion a special one and blessing us today. Once again, my heartfelt welcome to each and every participant in this conference. Before I complete my welcome speech, I would like to pay respect to all the nurses and healthcare professionals who lost their lives in the COVID war. God bless you all. Now I would like to welcome Dr. Mehta, the President of Bapio, to do the presidential welcome address. Thank you.
Thanks, Kumar. Professor Jean White, BINA Chair Kumar Sami, distinguished guests, ladies and gentlemen. Today is a very special day for the Wales Bapio, as well as Indian nurses and NHS in Wales. Launch of British Indian Nurses Association in Wales signifies a great leap forward for better quality patient care as a result of better well-being of Indian nurses and in turn, much better use of Indian nurses' abilities and talent. The NHS, since independence, has relied on migrant nurses who have undoubtedly contributed to the patient care even under most challenging conditions. Unfortunately, discrimination, bullying, and obstacles to the career progression of ethnic minority nurses are still impacting on their well-being. In spite of prime role played by nurses, they remain unsung heroes of the NHS. Bapio Wales has been an outspoken, proactive, and influential voluntary organization promoting equality and fairness. Our aim is to promote professional excellence and leadership amongst all healthcare workers and to empower them to contribute towards improving patient care. However, we also have proven ability to stand up for injustice and unfair treatment. Bina is an arm's length body of Bapio. It means, although it is a part of Bapio family, it will have full independence of working without interference while being able to use the Bapio infrastructure and influence. A big advantage to the NHS is Indian nurses and doctors coming from the same cultural background and working in the same trust. This will enable them to form a social unit, providing pastoral care for each other. I congratulate National Bina Chairman Mr. Marimathu Kumarasamy, Co-Chair Ms. Asha Day, and Honorary Secretary Mr. Suresh Pakiam. Equally importantly, I congratulate the Executive Lead for Wells, Ms. Kokila Swaminathan, and I understand it is your birthday, Kokila, so happy birthday. You chose the right day. Also congratulate Mr. Raju Metri for amazing progress they have made in a very short time. You have become one of the more important initiatives of Bapio in Wales, and I, on behalf of my executive committee, commend the launch of Bina Wales. Thank you very much. With that note, I request now our guest of honor, Professor Jean White, to please give your address. Thank you.
Houndar, and good afternoon, everyone. I've so enjoyed today. I must congratulate Bapio before I get on to Bina. It's been an exceptional day with such important messages for us all. I am really delighted to see the establishment of the British Indian Nurses Association, and I warmly welcome its launch in Wales today. I extend my congratulations to everyone whose hard work has helped to set up the new organisation, to give a platform to strengthen the voice of Indian nurses and to provide support when they need it. 2020 was such a difficult year for everyone, and it is wonderful to see something positive, such as this new association, emerge at this time. 2021 is sure to be better for us all, and I'm really hopeful, looking forward to the future, and I'm sure it will be much better for us all. I'm sure some of the delegates here today will have been touched in some way by the effects of the virus, and I would like to extend my sincere condolences to anyone who has lost a family member, friend, or work colleague. But I would also like to say thank you, sincerely thank you to all of you for your hard work, your professionalism through these most challenging of times. I think the response of nurses and midwives, along with all the other health professionals, has been truly extraordinary and outstanding. The Bina is emerging at a time with a far greater focus being put on tackling racism and race-based inequality. Particularly here in Wales, we are looking very seriously at this matter. This, as we have heard throughout today, has been in part through the pandemic and the findings of how the disease has affected parts of our society, but also the resurgence of the Black Lives Matter campaign following the shocking murder last May of George Floyd, the Black American man, at the hands of the US police. And as you have heard today, our First Minister in Wales has asked for dedicated work to look at racism and racially driven socioeconomic inequalities in the Welsh population. I'm pleased and honoured to say that I am part of the working group that is working on a new race equality action plan for Wales, which Jane Hutt talked about earlier this afternoon. I strongly believe that nurses and midwives have much to contribute and support the work to improve the health inequalities that we see in our society. And I look forward to seeing a strengthened role for them going forward in this area. One of my aspirations is for the establishment of a national forum for Black, Asian and minority ethnic nurses and midwives in Wales, and work is underway to explore how this can be set up before Easter. I hope that the local networks, peer groups and associations like BINA will link with this national forum to ensure grassroots voices are heard at a national level to help drive changes in our professions. In 2018, I initiated work through the Welsh Nursing Now campaign to improve diversity in the nursing and midwifery workforce. This work is progressing well, and I'm very grateful to Public Health Wales and the working group chaired by Richard Desir for their continued enthusiasm to drive this work forward, even during the pandemic. I hope that positive links can be made between BINA and the Nursing Now campaign. There is much to be done in terms of promoting diversity within the nursing and midwifery professions. I think it's hugely important to hear authentic voices and differing perspectives. And I encourage everyone to raise their voices and help us shape the nursing midwifery professions and the services in which you work. I know it is difficult to speak out sometimes, but with the support of associations such as BINA, I hope that more people will do so. And I wish this new association every success for the future. And my team within Welsh Government look forward to having a very positive working relationship. And I have enjoyed my contact with the members so far. And I wish them every success. Now, I understand we are planning to launch the BINA website. So Professor Singhal, I hope you'll be able to organise this so that we can formally kick this off. Yes, is he there? Professor Singhal, are we ready to launch the... Excellent. Fantastic.
Professor White, it's already launched at your button pressing. Thank you.
That's brilliant. Thank you ever so much. That's marvelous. And I hand back to the chair.
Thank you, Jean. Thank you. And thank you for your kind words. And thank you for your interest in race equality in Wales. And you will be working very closely with the health sectors in Wales to achieve this together. Thank you. Now I invite Suresh to come and do some update about the work done in Wales so far and introduce our executive leads for Wales. Thank you, Suresh.
Thank you, Kumar. Good afternoon, everyone, ladies and gentlemen, and honorees here. I feel really humble and also privileged to be part of this inauguration Wales launch of Albina and also part of Bapio conference. Before I go on, I'd like to say one famous quote, worldwide known quote, but it's one of the top 10 quotes in Wales. That is, tapping persistently breaks the stone. Tapping persistently breaks the stone. That means what? If at first you don't succeed, but try and try again. This is one of the famous quotes. Most of the Welsh people know about this. That means we have a battle in our hand, tackling inequalities, racism, discrimination, so many things in our hand. I'd like to say thank you to those people in the past who has been tapping this stone consistently. I'd like to say thank you to them, but now it's our turn to take that. Let's continue to tap on that. Some of the chips come away, but the large stone is still there, so unmoved. So we'll be working on that. Hence the reason BINA will play a major role in future, and especially in Wales, with the help of our regional leads and your pledge, Professor Jean White, working together, I think we will be able to achieve that. Just to give an overview of our BINA, we have two purposes. One is to provide a pastoral support to our nurses who are coming from India. So that work is really going well in UK. I wish that we will continue to work on those agenda in Wales as well. I heard that there are a number of nurses are coming in Wales, arriving soon, or people have arrived recently. So we'd like to work on that. The second one is to ensure we support our Indian nurses to thrive in the UK system by mentoring, coaching, developing a tailored program for them. So I'm sure we'll work on the Wales side as well. Thank you. I would like to introduce our Bina Wales executive leads, Kokila Swaminathan. Kokila is an advanced nurse practitioner. She's working in a health board, Wales. She has formed a BAME group within a trust. Believe it or not, she has over 200 members within that health board and already proving effective member, and changes are coming. Thanks, Kokila. Would you like to wave or namaskar? Thanks, Kokila. And our second executive lead, I'd like to introduce Mr. Rajiv Metri. He's on the screen as well. He's a senior cardiac nurse working in North Wales. And also he's got a unique title as well. He's first probably Indian local borough councillor working in North Wales. So I'll introduce Rajiv. Hi, Rajiv. Thank you.
Thank you. Thank you, everyone. Thank you, Jean, and thank you, Bapio.
Thank you.
Thank you very much.
And I just want to take this opportunity just to take 10 more seconds to say thank you to our great team behind. We have executive leads for various regions. I'd like to say Mrs. Sharon Sundar Singh is executive lead for East of England, and Samuel Jude is also executive lead for East of England. Mrs. Anu Thomas is an executive lead for North, and Manju C. Pallam, Dr. Manju C. Pallam is executive lead for North. Mr. Suresh Periyasamy is executive lead for Midlands, and Kala is also joint secretary, and Mrs. Jassi Chopra Powell is executive lead for South, and Mr. Simon Jacob is also executive lead for South as well as joint treasurer. And Annie Ponnambaram is our national treasurer. And I'd like to take this opportunity to hand over to Mrs. Asha Day. She's also our co-chair of BINA. She's got many credentials. I suppose just briefly to say, she was an ex-director working at very senior level, over 30 years of experience in NHS organizations and various sectors. She also been awarded as Fellow of Institute of Health Visiting. She recently won a BEM, British Empire Medal Award, for great work on COVID risk assessment. And I'll hand over to Asha. Thank you. Thanks for the opportunity.
Thank you, Suresh, and I'm going to keep it brief because everybody's tired. So first of all, I'm delighted and feel very honoured and privileged to offer the closing remarks or the vote of thanks. I just wanted to draw your attention to, I am a public health nurse, so this morning's sessions were absolute music to my ears, and I come from a profession that looks at searching for health needs. We are about preventing ill health, and for us it's always about improving health outcomes for our patients like it is for everybody else. And I must say, in public health, these are the real unsung heroes, the people that are behind the scenes that you don't actually see because they never make the TV. But what I wanted to draw on is some words I've picked up during the day and words that resonate, and also are themes within BINA, which is collaboration. Collaboration is the very heart of why we're here. And thanks be to Bapio, who said, we have this thing and nurses and doctors work really, really well together. It's a symbiotic relationship and therefore we need to concrete it. And we are still a very new organisation, but I think we punch well above our weight at the moment. Thank you for the collaborations. We also talked about leadership. We talked about the social determinants of health, equalities or inequalities. We talked about racism. We talked about innovation. And we know that during the last year, there has been so much innovation because necessity has made it that. The words that didn't come through, but I think I got, were words of compassion and resilience, commitment, and bravery. Those were all inbuilt within the conversation. And somebody said, quoted about me, but I think it's quoted about a lot of people. Remember the wombles with round bottoms? And it's a bit about that chipping away, but we always come back. We find something to come back, so we don't give up. So in terms of what I really want to bring from what we've said this morning and this afternoon is I'm absolutely committed as the co-chair and as Bina are, but I'm actually blown away with the collaboration, the depth and breadth of expertise that both organisations bring, and the amount of leverage we can have, not just locally, nationally and internationally. We all have those. The picture behind me is Alaska, and I have links in Alaska. So Tanuka and the non-government organisations over there. The impact that we've had on our legislative bodies, the inspectorate boards, the education bodies, and that we have a legacy to leave to our future and next generations, and it's for us to make sure that they have the education, the training, the support. And pastoral care, as Bina will say, it's not just about giving somebody, here's the church and here's what to do, but it's actually the emotional resilience that you give people. It's the psychological safety that we give. So really I want to take that. And also, if there's any learning you can do from England, I've been involved in RARES, the Workforce Race Equality Standards. And if you can take those 9 standards and look at them, it might be a way to accelerate your learning. Obviously adapt it to what you need it, but it might be a way forward, because I know that when I looked at the papers back in June, Wales were starting to do some absolutely superb stuff, and I'm sure it will overtake England in this agenda. So thank you very much. I think my 3 minutes are over. Thank you. Thank you, everybody.
Thank you, Asha. Now I'm handing it over to Dr. Singhal. Thank you.
Thank you very much. It's great to have the British Indian Nurses Association, and I wish you all the very best with this endeavor.
Thank you.
We now move on to the last item in our program, which is the Bapio Wales Awards presentations.
Dear friends, it has been a tradition for us to recognize the people who have done above and beyond the call of their duty to make a difference in the life of the fellow citizens. Our award ceremony this year will be done virtually, unfortunately without the Indian dinner from Rotiwala. And the trophies have been already delivered to the awardees. This is the 5th year of awards, and we hope that you will join to congratulate all awardees. While we always recognize professional excellence awards, this year we are also going to recognize the people who have worked for equality and diversity. I will now invite our chair of Bapio Wales, Dr. Professor Keshav Singhal.
Thank you, Asmok. And we're now at the fag end of our program, but the most exciting one as far as I'm concerned, where we actually in the old days would have given the awards and waited for the sumptuous dinner. Unfortunately, that's not to be this year. But the first award for professional excellence goes to a friend and colleague who has been absolutely instrumental in holding this day together. I don't think we could have done it without him. And to introduce him, I'd like to invite Dr. Latha Srinivasan, consultant anesthetist, introduce and provide his citation. Latha, over to you. Thank you.
Thanks, Keshav. Can you hear me all? Okay. I would like to start with the Professional Excellence Awards, which this year goes to Dr. Murli Verma, one of our very active executive members. Murli trained in India, US, and UK, gaining his board certification from US and FRCP pathology in 1999. Since then, he has been a consultant histopathologist at the University Hospital of Wales. He is one of the very few senior pathologists of Indian origin in the UK and has been honored by being selected as chair of the British Association of Urological Pathologists, among other national and international appointments. He is widely published with over 100 publications and in great demand for invited review and opinion pieces from reputed journals across the globe. He has been invited for guest lectures internationally and has provided expert advice, formulating various treatment protocols and data sets. Always humble, self-deprecating, and unassuming, he epitomizes the qualities we all cherish and would like to recognize. Congratulations, Dr. Verma.
Thank you. It's not often I'm lost for words. Thank you, Lata. Thank you for the kind words. Thank you, Bapio, for this award, which is very special to me. Now, as a histopathologist, one of the crosses I have to bear is that it is assumed that I spend time in the mortuary, when actually I don't do any postmortems at all. And my work is entirely about trying to keep patients out of the mortuary. So I'm very grateful to actually to be recognized by my clinical colleagues with whom I work as a team to help patients with cancer. So thank you again. Thank you.
Now, I'd like to invite Dr. Chris Jones, CBE, the chairman of the Health Education and Improvement Wales, to present the second award for services to medical education and research. So, Dr. Jones.
Hey, everybody. It's with great pleasure that I announce the award to Professor Pushpinder Mangat. Push, we all know him. It's a great privilege to be doing this as his chair. He's a great friend and a real colleague. Push came to the UK aged 2. He was educated in Birmingham, gaining his medical degree in 1978. He was a trailblazer when in 1984 he started ventilating critically ill medical patients on the medical wards in the absence of ITUs. And it was one of the first examples of that sort of intensiveness going on in Wales. Following completion of his training, he became the first Asian consultant to be appointed in Morriston Hospital as an intensive care anaesthetist. He was then Deputy Medical Director of Swansea between 2011 and 2018. And following that, we nabbed him and he became our Medical Director at Health Education Improvement Wales. In that role, he's been working to address inequalities, particularly with SAS doctors and of course with differential attainment. He's also supporting the Race Equality Action Plan for the Welsh Government. Can I say, this is such a well-deserved award. I really thank Bapio for this opportunity. Congratulations, Push. Have you got it there?
I have. Thank you very You can't see it because of my background that I've got on, but I've got it's similar to one that we just saw in the previous presentation. So I'd just like to say it's really, really humbling to be recognized by colleagues and peers in this way. And when I first got the email about this, I too was lost for words, but I've had a bit of a chance to recover. So, so I can say a couple of things. The most important thing I'd say is that I think I've been really, really lucky in my life. And when I came to Wales, there were several senior clinicians who supported me and invested in me, which and it was based on my ability. Things like doing like ventilating patients inside wards in the old Llanelli General Hospital. Well, it was saving their lives. It was the right thing to do. But those people spoke about me and encouraged me in that way. And Ed Major, who's the critical care unit is named after in Swansea, was certainly the main one of those. And every role that I've had since then, I've had lots of help for. And to be awarded this, when I look at the program today and see all of the the really senior and important people on the program. For me to be receiving this award in front of those individuals is just fantastic. I'd just like to finish by saying that the other bit of luck is that I've received this award for doing things that I really enjoy. Looking after patients, I've really enjoyed. Anesthetizing big cases, I've really enjoyed. Being a medical manager, I've really enjoyed. And working in HIW, I have to say, is a real joy too. So thank you very much for everybody's support, and thank you to Bapio for inviting me to today and for giving me this award. Thank you very much.
Our third and fourth awards are with a bit of a twist in the tail this time. These awards were already let out of the bag in the morning by our Deputy Minister. These awards are not for Bapio members. These are for two highly respected individuals who have done enormous amount of work for equality and diversity in Wales. They have been persistent, dogged, and they have not taken no for an answer. So for the first award, may I invite Judge Ray Singh, CBE, Chair of Race Council Cymru, to introduce our awardee and read her citation. Judge Ray.
Ask him. Please unmute.
Yeah, perfect.
Thank you, Diokumbar. Dhanyabad. The person I'm about to introduce is well known to everyone. She needs no introduction. But some of you may not know her. For your benefit, I will invite Professor Uzo Ayobi, OBE, to come forward. Uzo, as I've said, does not need any introduction, but it gives me great pleasure to welcome her and to say a few words about her background. Uzo was born in Nigeria. She was qualified there as a lawyer, as a barrister, and she came to Wales in 1993, having married before coming here. She followed me all around the country. She joined the Swansea Institute of Higher Education, where I was a governor, and she lectured there in law department for some 9 years or so. She followed me in the next step. I formed Indian Society for Southwest Wales. She has established African Community Center in the same area. Subsequently, having served as a CRE commissioner for a number of years, when I left, Uzo joined the CRE as a commissioner. And she joined the Southwest Police Force and then went on to the Home Office as a specialist advisor. She has recently been released by Race Council Cymru to join the Welsh Government in advising a specialist advisor on equalities to the Deputy Minister Chief Whip. Race Council Cymru and Bapio have many associations together, and Uzo has been a proactive promoter of that. As I have said, she has done a lot in the CRE, and after the CRE was demised, so was the race taken off the agenda. But the racism continued to expand. And she approached me and other former commissioners to set up Race Council Cymru. And this is where Race Council Cymru came into being. Uzo has also is a professor at the University of Wales, Trinity St. David's. She serves on a number of boards of numerous voluntary organizations, including she did with Red Cross and many others. She has worked tremendously hard, but she has not forgotten one thing, and that is her respecting her elders and the culture of respect. She worked extremely hard, begged, cajoled, and persuaded people to provide monies and formed elders association for the Windrush generation. There were many of them who were really elderly, and she managed to ensure that they visited places like Tilbury and Bristol and Liverpool for them to make their journeys back from when they started their journeys in this country. Many of them have moved on and passed away. Uzo does not stop. She is a defender of equality, and I have great pleasure on behalf of Bapio to award this award to her. Uzo Ayobi, OBE.
So much. Thank you. Thank you, Chair Judge Singh. I am absolutely blown over. Honestly, I just literally cried because this award just came a few days after my brother-in-law died very suddenly to COVID-19. He was only 58, and it was just a traumatic time. But when that email came, I just thought, my goodness, in the middle of all this, thank you so much to Professor Kesh and Dr. Hasmukh Shah and all the Bapio members. A special thank you to Judge Singh, who's always been a big icon to all of us. A special thank you to all the mentors. We stand on the shoulder of giants. And honestly, I say that all the big brothers and sisters are giants. I am so blessed to know you all. And I'm so humble that somebody thought about me, especially at the time that the award actually arrived. It was so powerful and uplifting. And I thank you all. I have to say that, throughout my life, I've had so many mentors, some in very senior leadership roles in Welsh government, people who've inspired me. I am so thankful to God that I was interviewed successfully to serve under the leadership of Jane Hart, MS. I have to say, what an inspirational leader. I've learned so much in that time. Working with Professor Kesha, who laid a wreath this year for in honor of the Indian people who died in the wars, it was such a joy and a privilege to work with him, to see his work and the risk assessment toolkit. We are all one. Whether we're Africans, whether we're Indians, in unity, we stand with our white brothers and sisters in Wales and hold hands to battle this pandemic. I thank all the mentors who've ever mentored me. I think of Mutale, I think of Mark, I think of all the people. I think of Jane Hart, Julie Morgan, all of you who've even invested one kind word towards me. I thank you all. Judge Singh, you've been such an inspiration, lifting somebody who'd been browbeaten by racism and just making me keep on powering on. Thank you so much, Bapio. I love you all. Thank you.
Now I'd like to invite Julie Morgan, AM, the Deputy Minister for Health and Social Services, to invite the second awardee for the promotion of the equality and diversity. Julie Morgan.
Thank you very much. And it gives me a huge pleasure and honour to virtually present this award for equality and diversity to Usha Lodva Thomas. Now, Usha is a great friend of mine, and we've worked together for many years, and it's wonderful to see you, Usha, here. Even though it's virtual, it is an absolutely wonderful occasion, and it has been a privilege to work with Usha. Usha arrived in the UK as a Kenyan refugee. Her passion was to make a difference to those who had no voice, and I think that passion has driven her in all the things that she's done. Following leadership roles in Barnardo's in Wales and in England, where I got to know her very well, she helped set up the Academy Wales. She was called a boundary spanner for her work in linking government to the community, and her untiring efforts have culminated in the Welsh Government's recent diversity and inclusion strategy for public appointments in Wales. And Usha is one of the prime architects of the newly formed Race Equality Action Plan of the Welsh Government, which we've heard about today. And in addition to all the work that she's done here in Wales, determinedly, patiently, she works with a number of NGOs in India and Africa, inspiring a sustainable change in their thinking and capacity to deliver for the most disadvantaged of our population. Her passion for doing the right thing and her charm wins over everyone she connects with. So it's fantastic, Usha, to be here to present you with this award, which is to acknowledge all that you have done and that you've done so patiently and over such a long period. So I'm very pleased to present this award.
Julia, I think it was a surprise to be offered the award, but even nicer surprise to have it awarded by you, because we are good friends, and you know I love you lots. We worked so hard together and shared some common paths together. But Bapio, thank you ever so much for this, and especially Professor Singhal, because as I said, I didn't expect it. It's come from the blue. I'm not used to being given awards, so I was a bit shy about even accepting it. I felt that the front line should have it, but I was persuaded by my mentor and my soulmate, my brother, who said, you have to accept it. So Chandra, it's your fault that I'm standing up here. I think whenever you get an award, you want to rush and tell your parents, don't you? And I think it's with the blessings of your parents and your elders that you stand on these grounds. And as Uzo said, on the shoulders of giants. So I just want to start by thanking my parents who sacrificed such a lot to have us here. And that includes my eldest brother who sacrificed a lot, his own well-being and his life to bring us to the UK. And for me to be brought to Wales, which I now see as my home, to receive this award from my Asian roots is especially honoring. And I really, really thank you for that. I just wanted to say a bit about the work in Barnardo's, where Julie took the first course. That's why my bond with her goes back many, many years. I rang her out of the blue and said, can you do something about the Asian Women's Centre we need? And Julie being Julie, she embraced it. And next thing I know, I was doing good work in Barnardo's with her. And Drew Reith, who was the director then, who with the senior management team made things happen that are just unbelievable. I was a new graduate. I was sort of saying things which people needed to do, and they just grabbed and ran with it. And I cut my teeth there really, because I learned everything there was to learn about equalities the really hard way. So thank you ever so much, Barnardo's, for that. In Welsh Government, I've had a couple of really good managers who made things happen, Harry Thomas and Claire Bennett, and two really excellent teams. Iana and the team there have been amazing in terms of getting some work done. But the leap of faith really came from people like Jane Hutt and from Mark Drakeford and Ron Gathin. For some reason, they seem to believe in me and trust me with things and ask me to do things, which always sort of shocks me a bit, but I dive into it. I had really good mentors, like Uzo mentioned, you know, they always influence, grow, they're gurus, they're senior people that you look up to. And I just need to mention a few because they are very special to me. Yvonne Cannon, Trish Reed, Dana Nagal, Singh, Susan Baker, my friend Uzo, Professor Bono, Professor Bellamy, and certainly last but not least, my younger brother, but
my constant friend and somebody who picks me up every evening and puts me back together when I'm thinking I can't go on anymore. So I'm really, really appreciative of it. I think one of the things about this work is that you can't do it on your own. So it's not just the mentors and the people, but it's the communities. And ever since before I knew Julie, it's the lived experiences of people in their communities, and especially through the activists. And I repeatedly find that pattern in India or Africa, wherever I go, that there are people working with communities who are never recognized, ever than some heroes. And if it's okay, just today, I'd like to share this with them because they won't be able to come on a stage like this regularly, but I think they deserve it. So Bapio, thank you for making it possible for me to share this with them. And I feel quite emotional. So Professor Singalia, thank you very much. And I'll get my back on you at some point. Thank you.
Thank you, Usha. Very kind words. Great work, Usha and Uzo both. Our last and final award, but not the least, is to a very old friend of Bapio, somebody who associated with us when we were really a fledgling organization in Wales and has been steadfast in his support and encouragement. May I invite Jane Hutt, Deputy Minister and Chief Whip, to introduce our next awardee, please.
Well, thank you very much, Professor Keshav Singhal. I am delighted to present the Bapio Award for International Leadership, and that award goes to Professor Martin Steigal, who's the Pro-Vice Chancellor for Research and Student Experience at the University of South Wales. Former Dean of the Faculty of Life Sciences and Education at the University of South Wales, he was previously Associate Dean, Director of Undergraduate Studies at City University of London. And all of us who know of his work and his career know that Martin is a visionary academic who's led by example in promoting international leadership. He enthusiastically embraced Bapio's idea of promoting leadership courses in India and has so far led 4 seminars benefiting hundreds of local Indian faculties. It was due to his efforts and collaboration that the Bapio Training Academy was able to launch the 2+2 program, which is now recognized by the GMC for training Indian doctors in the UK, but also achieving GMC sponsoring body status for Bapio. And these are huge achievements. He's successfully led the research collaboration between the University of South Wales and the Manipal University of India, with many more collaborations on the way. So we all, those of us who've got to know Martin over the years, recognize his commitment locally, nationally, and globally to his commitment to international leadership. We're proud that he is part of us here in Wales at the University of South Wales and such a supporter of Bapio and all of the agenda and that we've been discussing here today at the Bapio conference. Well done, Llongyfarchiadau, Professor Martin Steigal.
Thank you so much, Jane, and thank you to Bapio. I'm really humbled to be given this award. It's difficult to describe, but it's a real privilege and pleasure to work with Bapio, with Keshav Singhal, with Haz Shah, with Dr. Mehta, and indeed Parag Singhal. And it's been amazing to be able to go out to India and do the leadership work, and it's been great doing the 2+2 work with Parag and indeed Keshav. I don't really feel I deserve it, but I'm really, thank you so much. I'm not sure what else to say. It's really humbling, and I just thank you. Really enjoyed everything to do with Bapio, and look forward to continuing as best I can in the future. So thank you very much, and thanks again, Jane, for that lovely introduction.
Thank you. I now invite Mr. Ashish Khurana, spinal surgeon, to propose a vote of thanks.
I'm sharing my screen. Can you see that?
Yes, we can, but we can only see your, currently we can see your desktop.
Yeah, I'll just make that into. Sorry, So we are to the end of a deeply engaging and hugely enthralling day. I must extend my deep gratitude to the First Minister, Professor Mark Drakeford, our Health Minister, Vaughan Gething, Deputy Minister, Mrs. Jane Hutt, and Right Honourable Alan Keynes and Stephen Doughty for their overview and update about the current status. And more importantly, for being with us. For being with us not only today, but throughout these tough times, for supporting our meeting and us as individuals, as key workers, and as members of the BME community in our fight against COVID. I would extend my sincere thanks to Honorable Dr. Harshvardhan, Cabinet Health Minister for India. His participation and an inspiring talk underlines the principle of global collaboration in our mutual fight against COVID. And of course, it reiterates the age-old Indian philosophy of Sarve Bhavantu Sukhina. I would thank Her Excellency Gayatri Sarkumar for her participation and a captivating address. I would like to thank Professor Lord Ajay Kakkar for a great insight into a deeper analysis of causes of disparity in NHS and the wider society, and Professor Iqbal Singhal for a really stimulating talk on opportunities in advancing medical professionalism. While doctors continue to make life and death decisions, our own GMC has a crucial role in regulating us, indeed, in the right spirit. We had a thought-provoking discussion by Mr. Anthony Omo, Director of Fitness to Practice, GMC. We heard progress in various fronts in their talks by Dr. Andrew Goodall, Dr. Heather Payne, Dr. Frank Atherton, and Professor Push Mangat. I extend my sincere thanks to them. Education and learning evolves with discussions and mutual exchanges. The partnership was evident in the presentation itself. Thank you for your intriguing speech, Lieutenant General M.D. Venkatesh. Today, we established an MOU between Bapio and the Cardiff and Vale University Health Board. I congratulate and thank all the team members involved in making this happen. We also launched the Welsh chapter of BINA, British Indian Nurses Association. We look forward to working closely with BINA and wish them success in their pursuits. Dr. Ramesh Mehta has been at the forefront of Bapio for several years. I thank him for his unfaltering support to Bapio Wales. I thank Professor Parag Singhal and Dr. J.S. Bamra, along with other panel members, for providing a fascinating panel discussion. I would like to thank the entire team of Bapio Wales under the able leadership of Professor Keshav Singhal and Dr. Hasmukh Shah. Their untiring efforts inspire the entire team to keep going. I would also thank our technical director, Shashakiran Chemudipati, and the organizing team of Dr. Poonam Singhal, Dr. Murli Varma, Mr. Chandrataya, and Mr. Kotwal to help with Zoom planning and organizing. And of course, all the attendees without whom the meeting would not be a success that it was, and so many other valued contributors of the day that I may not have named. You are like the ITU nurse who hides behind the PPE and saves lives without being specifically named on the thank you card. And at last, and biggest of the all, I'm sure you would join me in thanking the bottom of our hearts. Thank you very much.
Thank you, Ashish. Thank you to all of you. I mean, it's been a long day. It's a Saturday. It's very good of you to contribute your whole Saturday. And I hope that the program was of interest and use. Goodbye.